Safety Committee meeting of the Holyoke City Council to order at 6:30. With me, and I'm going to just name the councilors, because I do have a lot of guests, and I appreciate all of your input, and thank you for being here. But we do have committee members, Councilor at Large Joe McGivern, Council President in Ward 7, Councilor Todd McGee, and on the phone is Councilor Howie Graney. And I don't think I have any other counselors at this time, but the first item on the agenda is, I'll take a motion to take item 1 off.
Second, so moved.
Okay, all in favor? Aye.
Aye.
It's introduced by myself. It's ordered that the Public Safety Committee meet with representatives from the Opioid Substance Abuse Task Force, the Health Director, and Judge William Hadley to discuss the need for a short-term residential transition program to assist individuals returning from a treatment program. The goal of this would be to improve the chances of long-term success for these individuals. The resident capacity would probably be around 20 beds. And let me just say that I filed this at the urging of the Police Opioid Substance Abuse Task Force with the Behavioral Health Network, the Sheriff's Office, detectives from the Holyoke Police Department and Community Policing and the Sheriff's Department. And I know Sergeant Hart is with us. I believe Detective Beeman is going to, Beeman, and I'm not sure how, is it Bevan? Sergeant Hart, can you help me on that? I think it's Bevan, is going to be joining us. But before that, I just want to let you know, and Judge Hadley has let me know that because of his position, he can't get involved in a political discussion. However, he's allowed me to say a few things that he has written down for me, which indicate the need for this kind of facility. And so I'm going to read those. These are comments from Judge Hadley. Clearly, one of the things he said, the more resources need to be available in Holyoke. Too many people have been falling through the cracks, particularly during the pandemic, but even before that. I regularly advise people whom I order committed to state facilities for emergency treatment that they need to follow up with care immediately upon their release, and too often this does not happen. For all of these reasons, I think the opioid task force and the dedicated men and women who are part of the HPDs and angel policing, I thought those were great words, effort are doing some great things, and I applaud the efforts in this regard. And again, I want to thank Judge Hadley for making sure I understood why he couldn't come, and also for offering his comments, which I think are right on target. If I can, Sergeant Hart, since you were the one that invited me to meet with the opioid task force, I'd like you to just start off. And I know part of the problem is we've had people come in and they get back into the city and they've done some good things in rehab and they just fall through the cracks. And so we're trying to make sure that we have a facility that still offers support, gives them that additional chance for full recovery. So Sergeant Hart, if you would.
Counselor Murphy, one quick comment.
Yes, Councilor Graney.
I think Counselor Sullivan has joined us.
Oh, okay. I'm sorry. Councilor Mike Sullivan, Councilor at Large. Mike, not congratulations. Well, all of you can be congratulated for joining us. Thank you for joining us. All right. So, Sergeant Hart, if you would.
Okay. Thank you, Counselor, for having us tonight. And we did have a very good meeting when you came down to the community center. And I think this is where we left off in trying to find some type of housing to try and prevent some of these individuals who are seeking treatment to have a place to stay if we're unable to find a bed for them for treatment for that night. Because a lot of times what happens is once they decide they're ready for treatment and they come in to our center and we look around and we don't find a placement for them, then it's very unlikely they'll come back again the next day. So I'm not sure if you're aware, but I know we discussed this in the meeting that the mayor and Mike Bloomberg and other staff were working on trying to secure some type of housing for this and for the homeless. We were discussing the War Memorial as a possible place for the cold weather and everything. However, immediately after leaving that meeting, I was contacted by a woman from the Department of Housing and Community Development, and she said that they were in conversations with the mayor and that she would like to provide the city of Holyoke with 40 beds as a homeless shelter. They had picked out Motel 6 as the place to have these housings and made arrangements with the owners of Motel 6.
Okay.
And that was, I guess, sometime in November, just before Thanksgiving. And them, along with the staff from the Center for Human Development, CHD, would be kind of managing and running the shelter itself. And we would be providing recovery support, clinical and therapeutic support, whether individuals had mental health issues or substance abuse issues, but were homeless here in Holyoke. And I think our staff, along with CHD, have formed a partnership and are doing really well. And we do have a full 40 beds filled at this time. CHD is doing a great job in trying to find some more housing, more stable housing for these individuals so that we can transition them out and get more individuals in, especially those who we send to detox. And after they complete their detox, they're looking for housing. So
Right.
that's
Okay.
where we're at right now.
Okay, thank you, Sergeant Hart. Let me recognize that we have Mayor Morris with us, and thank you, Mr. Mayor, for being here. If I can, I also want to emphasize we've got two of the detectives from the task force, Detective Joseph Emeterio, and I'm probably not doing a good job on that, Detective, forgive me, and Detective Dorota Babin, and if I'm wrong on that, again, forgive me. And do we have anybody from the Behavioral Health Network? Does anybody know? Detectives, do you know if we have anybody from the Behavioral Health Network?
No, Counselor, at this time, I believe we do not have anybody from
Okay.
BHN here. Yep,
Okay, thank you. And
Well-
I thank you for coming, Detective. And
absolutely.
Did I butcher your name? If I did,
No.
I'm sorry.
No, it was good. Thank you.
Okay, so again, as I met with the task force, and one of the things that I heard was the concern about people who have been to detox and then come back and then need that extra support, or kind of a place where they can know they've got support if they need it, and that's sort of the goal here. So, if we could, I know I'm glad to hear about the Motel 6, and I'm assuming one of the concerns I would have, I'm glad we're trying to provide shelter, because there was one of the orders on the agenda here is, are we going to use the War Memorial for a shelter? So obviously that's probably not going to happen. But can we be in a position where we would have a residential situation for people who are coming out of detox, and then a separate one, if you will, for people that we're trying to get service for? I mean, I don't know if they complement each other or not, and I'm certainly not an expert on that, but I'm just wondering if that might create some difficulty in terms of getting that support network. Before I go through, I'm going to recognize Councilor McGivern.
I'm not sure how you want to handle this, Mr. Chair, but I just have some questions for Sergeant Hart or.
Yep.
if I could through the chair. John, thank
Absolutely.
you for
Absolutely.
being with us again.
Mhm.
I understand the need for a homeless shelter, but I don't think is exactly what we're looking for in terms of the task force, or what, the issue is with the opioid crisis itself.
Right.
I think Councilor Murphy stated it perfect. Where, they're looking for people who, detox is not, it takes a little bit to get into, but once the individual is detoxed, the question is, where do they go next? Now, if you look in a lot of neighboring counties, and then it's starting to happen in Hampden County. One of the better examples is Northern Hope in Franklin County. After the detox, they have TSS and CSS beds that are transitional beds, but longer detoxes. And I think that's what the task force should be looking at, because I don't see it in Holyoke the way it's starting to show in Springfield and in other areas. But a homeless shelter at the Motel 6 is the last thing we need. I mean, it took us forever to get the homeless from people who were being placed from Boston in the former Holiday Inn. That's not the idea here. The idea is to get some help to people who need it with addiction, with substance abuse.
Right. So that was the first the part of the task force is currently looking for places for, just like you said, for those people coming out of detox and continuing on with their treatment. This was just one of those things that came through the state, and we wanted to address an immediate problem. We knew we were coming up to winter, and we knew we had some cold weather ahead of us, so the homeless was a concern, and we do know, and our detectives can attest to that, a lot of the homeless, the majority of them, do have mental health issues and/or dual diagnosis with substance abuse as well. So that part of that is those individuals are being worked with and encouraged for treatment. It's not just a homeless shelter, but as far as a permanent one, I know the last time I spoke with the mayor and Mike Bloomberg, we were looking for places throughout the city that we may be able to have some type of temporary housing for those individuals for substance abuse, and maybe the mayor can talk a little bit more on that.
It can't be temporary housing without management of treatment and without people on duty. Otherwise, you're just giving people a place to go to without the help that they actually need.
Right. So part of the police department through several of our grants will be doing the treatment portion, and I know through the mayor that they had a designated management organization that would be managing the shelter.
Thank you.
All set, Councilman McGee? I mean,
yes, thank you, Mr.
okay.
Chair.
I mean, I agree. I think, and I'm happy to have a homeless shelter that, because if we get someone where we have a chance to, and I agree that we need to have someone that can offer them opportunities, let them know what is available, and hopefully if they do have substance abuse issues, we can potentially get them to the point where they would go get detox and get treated, and then maybe they could come to the residential area. But I'm agree with you, Councilman. I am under the impression, and I think if we can do a separate temporary residential area for people coming out of detox, to make sure that they have local support and counseling right then and there, knowing they come back and not coming back into the general community, which, as I understood it during the meeting that I had, that was one of the problems. They get themselves back in the general community, and it's just too hard. It creates such a challenge to stay off and to stay fighting their concern. So I agree. I think, my goal here, and correct me if I'm wrong, either detectives or Sergeant Hart or Mayor Morris, my goal would be to try to come up with a facility, and I mean, I don't know if this would work, but one of the things I thought about was, well, you know, is there some space at Providence Hospital that could become a residential facility for a temporary residential facility for people coming off of treatment? Or are there other facilities in the city that we can create a supportive environment so that people who have gone through rehab know that they can come back and still have some additional information? And that's where I'm coming from. And I see our Board of Health Director, Sean Gonsalves, has his hand up. And Sean, I'm going to recognize you. So, Sean.
Thanks, Councilor Murphy. Providence Hospital.
Thank you for coming. I appreciate it.
Oh, no problem. Happy to be here. Providence Hospital, perhaps 18 months ago, they actually closed a number of inpatient treatment beds at the hospital. So Trinity Health, as part of a restructuring and a reorganizing, they had beds at the facility specifically for this purpose, and that program and that occupancy was removed less than 2 years ago.
But yeah, I'm aware of that, and obviously I'm not happy about it. But my thought on that would be, I mean, it might be beneficial to them in terms of having, I mean, again, how we would pay for this service and how do we organize this and all of those kind of things would be determined. But clearly, it appears that they would have space and potentially the ability to provide a residential section that could potentially meet the need of 20 to 30 people coming back from rehab. And again, I don't know if that would, and if not there, then we need to find somewhere else, because I agree. I mean, when I heard the detectives and Sergeant Hart and the Behavioral Health Network talking at their meeting, I heard people coming back and really being gung-ho that they had gone through rehab and they, you know, just thought, okay, now what do I do? And they got back into their community, and unfortunately, it's a very difficult thing to stay off. And they get back to the point where they need to get the support again. So I'm just trying to get to the point, if we can do it, and I think we should try, let's try to make sure we have a facility where when the task force is out there and they're getting people to be willing to commit to rehab, and they can also be there to say, and when you get out and you're coming back to Holyoke, we want you to come here for whatever, a month, 2 weeks. I don't know what the time frame was, but enough that there's support to continue that path. And again, every human being, we got to make sure we try to take care of them. So that's my goal, and that's why I filed this order. If I can, let me recognize the mayor, Mayor Morse. Thank you for attending again, and you're up.
Yeah, of course. Thank you, Councilor Murphy, and just want a quick thank you to everyone on the meeting tonight. I see many folks who have been working diligently on the opioid crisis in our community and developing wraparound services, representing a number of different agencies and efforts, and you know, this has always been a cause near and dear to my heart and my family's heart, and it affects countless people here in the city and across Western Mass and across our country, and appreciate the conversation and just a couple of thoughts, Councilor Murphy, and forgive me if I skip ahead a bit. I'll just provide a little bit of an overview, and obviously many folks on this meeting know the complexities of this issue, but it's much more than just finding a vacant building or vacant space. It's really about the investments and the programs and the services and the resources, and we don't want to set folks up to fail. And also around the conversations of setting up even a temporary emergency shelter. Oftentimes traditional shelters discriminate or put up additional barriers to folks that are struggling with substance use disorder. And so how do we make inclusive places that are specific for the needs and challenges of folks that do have these challenges? So on the shelter question for a moment, we are, as Sergeant Hart alluded to, and this isn't a specific effort for folks with substance use disorder, but given the impact of the pandemic in the winter, DHCD, Department of Housing and Community Development of the state, reached out to a number of communities, including Holyoke, about the expected need of emergency beds in the city. And so MEMA and DHCD asked, they came into the city, they asked for 3 sites and locations to to visit as possibilities. And the understanding was that this would be temporary through the end of March or early April for the winter. And they looked at the War Memorial, they looked at Dean, and I can't remember the third location off the top of my head. And MEMA and DHCD came back to the city and said that the Dean gymnasium, because it's separate from the school, would be the best place for a temporary emergency shelter, upwards of 40 beds through the end of March or early April. And they're working with the Board of Health and the emergency response team there to get the proper permits to move that up. Longer term, there's weekly, the Coalition to End Homelessness of Western Mass meets on a weekly basis. And there are plans to have a longer term, more permanent shelter beyond this winter. That would be, Sean could probably provide more context, but I forget the name of the organization, if it's Friends of the Homeless, to do a more permanent, longer term shelter in the city of Holyoke beyond just this pandemic and beyond this current winter. And so, you know, obviously we've collaborated with regional agencies. We have the congregate shelters in the city. But this effort with DHCD right now, it's emergency shelter just through the end of March or early April. And there's ongoing conversations about setting up a more permanent shelter elsewhere in the city. And just to come back to,
is the state paying for that?
yeah, so
Okay.
the state's paying for every single aspect of the emergency shelter, from installing a temporary floor to 24/7 security, to social workers, 40 beds. They go in and out, they do what they need to do. They work with the building department, the fire department on building and fire permits, safety. They've been in touch with the school department, the superintendent who provided his blessing, you know, given the use of the lack of use of the gymnasium at the moment. So 100% funded by the state. And again, they reached out and they see a need from their perspective. And so they wanted to help the city make this happen at no cost to the city. And that includes every aspect. And it's still ongoing. We're hoping it'll start moving very quickly. There's conversations that were happening even up to an hour before this meeting with Sean and folks at DHCD to make this happen as soon as possible. But it's upwards of 40 beds. And then as we continue to make progress on the permanent shelter, it would be an advantage if we were to help find a facility or put out an RFQ or RFP to building owners in the city. And, you know, we have different pockets of grant funding that could potentially go towards this. But I also recognize the need to have a specific, and this issue is so complex around the substance use disorder, because, I mean, there's detox and then there's CSS, there's step down programs, there's halfway houses, and there's so many gaps and holes in that process, whether it's insurance not covering more than 14 days of a step down program, to the lack of affordability of a sober house for folks that are expected to get their life back together, but also work at the same time. In a typical shelter, if someone's on, you know, certain type of medication, after they get out of detox, they need access to that. And so it's complicated, and you know, happy to help convene conversations and reach out to agencies in the Valley. We just don't want to set folks up to fail or to relapse, you know?
No, I appreciate that, Mr. Mayor, and I appreciate
Mr.
all
Chairman?
the input. So, Councilor
Mr.
Graney.
Chairman?
Councilor Graney.
Yeah, just if I could, through the chair, ask a question to the mayor.
Absolutely.
Mr. Mayor, would the access to the Dean Tech Gymnasium, would there be access to any other parts of the building?
No, so it would be exclusive access just to the gymnasium on the other side of the street. And so there would be barriers, no entries, 24/7 security, blocked between the gymnasium and other parts of the school. I don't know, Sean, if you have other details on that.
I am familiar with the layout. I am familiar with the layout. That's good to know. Thank you.
Yep.
Okay. Sean, did you want to answer that?
Oh yeah, just briefly. I know that's you know, also item number 3. We'll talk about that a little bit more, but there is a total separation. Staff will not be, you know, there's no shared staff between the facilities either. Same thing with, like, even as something as simple as meals, that'll all be generated inside that shelter area that's designated. So there'll be no flow of traffic between the buildings, and there will be, you know, several efforts to make sure that there isn't any traffic in one way or the other. So they'll be totally separated.
Okay. And
Thank you.
could I just ask, in terms of Dean, since I used to coach there in terms of the gym. So is that, I mean, are we putting like screens? Are we dividing it, or is it just going to be a wide open 40 beds?
No, so actually, FEMA will not allow for shelters such as that to be wide open, like an emergency shelter may be. So
Okay.
there's actually a pretty extensive plan for what they refer to as pipe and drape, which is
Yep.
rolling, frames of aluminum tubing with opaque drape or curtains in between. So each bed will have privacy, like individual spaces, and so they're living spaces. I mean, they're semi, we'll say they're temporary, but they're set up in a way where people will not be out in the open and exposed. And so we'll do fire inspections to make sure that
Yep.
things are properly, there's enough smoke detectors, enough carbon monoxide detectors with the extra load, and the layouts are all being reviewed right now as part of a building permit application. So there'll be, once we get a little bit further into the permitting process, there'll be full walkthroughs with fire, with the building, with the Board of Health. And so this is meant to be a livable situation for several months.
I appreciate that. So we're talking 40 beds at Dean, and we're still keeping the 40 beds at Motel 6?
Yes, that's until, the funding's up until, end of March, April.
Okay. Okay, for both of them.
No,
Or
that's
is
just the
Dean-
funding for the Motel 6.
Okay, and the Dean thing is under a different funding source, right?
Hello, Mr.
Yeah, so
Chairman.
it's also a partnership with DHCD, but it's a separate project. This one's being handled via MEMA, DHCD.
Okay.
Friends of the Homeless is involved here as well, but it's a isolated project from the treatment beds.
Okay, I think we certainly have dealt with issue number 3 on the agenda pretty well here, and we'll take that up and finish with it. But can we just go back in terms of number 1? Have we tried to establish, and let me also recognize our Ward 6 Counselor, Juan Anderson Burgos, who has joined us.
Thank you. I'm sorry for interrupting. I just wanted to make you aware that I was here.
Yeah,
Thank
no, you didn't interrupt, and I'm glad I could recognize. And also, Ward 3 Counselor David Bartley has joined us. And if there's others that I'm missing, I apologize. But so getting back to potentially, and I made the order based on 20, and I don't know if that's, but I'm thinking from a aspect of not having to have a huge facility and have something that would be manageable in terms of having a support where people are coming out of rehab and having a place where they can reside and get the support that they need. Have we reached out to any properties? Have we considered how we're going to fund it? Any of those kind of things? And anybody? Sergeant Hart?
Yeah, I know, through, we have funding through, I believe, the Department of Mental Health, through one of our crisis intervention grants.
Okay.
We reached out to them to, if they would support funding and fund kind of like a living room program like they have in Springfield. And last funding, I believe they picked somewhere out east first, but it was brought up again, and we do have another community meeting coming up with them, so that'll be brought up again.
Okay. And I know, and correct me if I'm wrong, that the Springfield program has been relatively successful, and if we could kind of model ourselves after their program, that seemed to be somewhere we would like to try to go.
Yeah, that's already been a proven success. So
Yep.
We would definitely pilot something like that, and then make any changes if necessary.
Okay. Do any other counselors have any questions or comments here? I don't see any hands up on. Okay.
Just
So,
on the Motel 6.
Yep.
Who's paying for the rooms?
The Department of Housing and Community Development, the state.
Mr. Chairman?
State issue.
How does that work, John?
1 second, Councilor Granny.
I'm not sure. It's through state funding. They pay, they negotiated a room rate with the owner, I believe, of Motel 6.
Maybe
Councilor
have an
McGee,
inventory of how many beds are in the city of Holyoke right now?
No.
CHD has 3 family shelters, close to 80 beds. Providence Ministries have 3 sober living facilities, very well run, close to 90 beds.
Mhm.
There's others out there. I think the temporary shelter, Mr. Mayor, is great, but who's going to run Motel 6, or is it just going to be like it was before? I mean, I can tell you, Sergeant, you know, and I know as a probation officer, how many times I was up there.
No, it's being run by CHD. They have staff there 24/7. They
Tell you how many
do,
times I've been to CHD shelters in Holyoke too.
yeah, they have staff there. Our detectives go up there daily on day shift and night shift. They do room checks. So it's been working out pretty well. We haven't had many problems up there so far, knock on wood.
Are you familiar with the CHD shelters on Oak Street and Beach Street?
Yes.
Are you familiar with the drug task raid on 188 Oak Street where some beds were there from CHD shelter?
Yeah, these are a little bit different because these are only for individuals. It's not for families. It's not for
That's not the point, John. Are you familiar with the drug raid?
Yes.
Okay. We need more than beds. We need treatment. This is what I mean. I'm sorry if I'm missing this, Mr. Chairman, but your order is specific about treatment.
Yep.
This is not treatment.
Right. If I can, so not only do we have 40 rooms, but we also have 2 rooms for clinicians. So we have clinicians through our grants that meet with these individuals in the Motel 6, and we have recovery coaches going up there daily. So it's not like it's a permanent place for them. We're in the process of transitioning these people out to detoxes and enrolling them in MAT programs. And like the mayor said, it's not easy. A lot of these individuals don't have IDs, don't have insurance. So CHD is working to get these individuals IDs and insurance and whatever they need in order to get into these programs. It's not one of these deals where someone can come in and you just bring them to MAT and they can start on a Suboxone program. There's a lot more involved, so it does take time for them to transition out and get new individuals in there.
Thank you.
Councilor Granny?
Yeah, just a question. If an operating business like the Motel 6 is turned into a homeless shelter or a treatment center, does that change the tax status of the building?
I couldn't answer that for you, Councilor Granny.
No.
It may, but I doubt it. Unless it was permanent. Mayor Morse? Did you
No,
want-
because no,
Okay.
CHD isn't. If they were the property owner, there would potentially be a shift, but it's still privately owned and being contracted out. Typical room, like a room rental, just being paid. It's the only difference is the payer.
Okay. Well,
Okay,
if I
thank
can,
you.
go ahead, Councilor Granny. Councilor
Yeah,
Granny?
thank you. That's good to know.
Okay. So, Sean, Councilor Gonzalez, Sean, I don't know if that's a
Yeah, I
promotion
just-
or a demotion, Sean.
I just wanted to quickly answer one of Councilor McGivern's questions about how it's paid for. The temporary shelter that the Board of Health is working with several agencies, with DHCD and MEMA, that's paid for through FEMA funds that are administered to MEMA, and then essentially what happens is the operator, in this case, of the temporary shelter, which is CSO, Friends of the Homeless, they lease the building and then the lease costs are paid through a MEMA grant. And that's, I'm assuming that the infrastructure might not be exactly the same, but it would be similar. It would probably be FEMA funds that are being paid to a contractor who is the middleman between the facility, in that case, Motel 6, and the emergency management agency.
And both
I
of them.
I
Go
think the,
Well, my question is sometimes these agencies and so forth, I mean, the tax status of these places is somewhat questionable, and I just want to get it straightened out exactly what the tax status of the building would be. Thank you.
Okay, Councilor
I could-
McGivern.
yeah, Sean, thank you. And the reason I asked about how it's paid for is we just got hit for $2 million of what would have been free cash for grants that were not being managed and were deficient at the end of the fiscal year in June 30th. And I think the temporary shelter is a great concept. I think the mayor explained it. I think it's set up perfectly, and I think it's a good location. And I think that, you know, that's doable regardless of how it's paid for. But if we have to accept the grant, which we haven't, and then that grant we become responsible for, and that grant is for whatever reason running a deficit, we then end up paying for the deficit, and that's taxpayers' dollars that we don't have. So that was the only reason I asked that question. The Motel 6, when we saw the nightmare, we lost the Holiday Inn because they used that as a homeless shelter and it got destroyed. And I just, you know, question why we're going back to letting the state use motels and hotels for homeless people instead of building facilities is what we desperately need. But the state likes to do a Band-Aid and then dump it on the city and let us pick up the broken parts at the end of the long-term, short-term periods. And I'm sorry for being cynical, but I've seen too much of this and it's never been well managed.
Good points, Councilor. If I can, we have a very long agenda, and I want to emphasize a few things. That the order, and my goal with the order is to, within Holyoke, establish a permanent residential facility, not where someone's going to be there permanently, but a permanent facility where we can provide transitional support for people coming out of rehab. So if it would be all right, knowing that is what I'm hoping the goal will be, and obviously we can't do that tonight because we're not going to sign a lease tonight unless we, you know, I could let you use my attic, but it wouldn't work. But if we could, knowing that that's the goal, and that it's with people coming out of rehab, that does not deter from those other things, which, as I understand it, again, the Motel 6 plus Dean are 3-month situations and would go to potentially April. And then eventually, I think we need to talk about how we do that. So if it would be all right with the committee, or if any other councilors have any other questions, or Mr. Mayor, if you would like to make any additional comments on this. If not, then I would suggest that we table this for maybe 45 days to have a chance to look at how we would get funded for this, what kind of locations might work for this, and then hopefully, you know, get in where we're going into the spring, maybe get to a more formal situation where we now have a location that we would like to have this residential facility for people coming out of rehab.
Yep.
Mr. Mayor,
Councilor, thank you, Councilor. The only thing I would add is really listening to folks on the front line in the recovery community to tell us more about sort of the asset map of what exists and where the biggest gaps are. So as we move forward, we're really focusing on the biggest need, not replicating what's already there, but really making sure we're making up the difference of what's needed in the city. And I know there's been a lot of feedback on that already, but it would be great to consolidate that so our planning is more strategic.
Yeah, I'm all for making sure whatever we do makes a difference. Otherwise, why do it? But again, just based on the conversations I had with the task force, the Behavioral Health Network, clearly the success of someone coming out of rehab, almost without exception, would have a greater chance for long-term success if we can put a residential facility together. So that again, that would be the goal. And I'm going to recognize Councilor Sullivan, and then Sean, did you still want to say something? Okay, Councilor Sullivan, you're muted.
Just had to find the button.
Okay, you got it.
So just a couple of observations from what I heard. Number one, in regards to Motel 6, as far, I heard a lot tonight about what's going on and the staff that's provided up there and everything else. And all I can say is they're not doing a very good job. All right. You can see the people coming out of there and going to various panhandling stations throughout the town. There's drugs being delivered right there in the parking lot, across the street in the parking lot, and behind Lynch School. All right. If I can pick up on this, I don't know how the people working there don't pick up on it. As far as programs and stuff to help them out, Sheriff Kochi has an excellent program, a 90-day program, right, over at Stony Brook. And this is not a political question. And it's a shame Judge Hadley couldn't be here to answer why more people aren't being sent to this program and why they're being put back out on the streets again for the financially strapped city of Holyoke to deal with. All right. And also, I think we ought to, if this is being tabled, we might want to invite Sheriff Ash in also, because he is making efforts to come up with a program and a facility in Holyoke. I hope some people are aware of this, but for people coming out of programs where they do get support. So that's something we should be aware of, and hopefully we can get them in at the next meeting since this is being tabled. Thank you.
Yeah, I would certainly be willing to do that, and I've had preliminary conversations about that, Councilor Sullivan as well. So, but if
Councilor
it's all right
Murphy,
with, go ahead.
if I can just kind of comment a little bit on what Councilor Sullivan said. We do work with the Sheriff's Department. They are one of our partners in our community center, and we do utilize, they do have a volunteer program over in Ludlow. And it's on a volunteer basis. And if some individuals want to come and volunteer and go to that facility, the Sheriff's Department will come and do the transportation. If they're there 5 days and they decide they don't want to be there anymore, then they're transported back. But that's on a volunteer basis. As far as the other one in Stony Brook, that's the judicial course, and it all depends on that's just one of the options through the judicial process to send them to demand someone to go to treatment. So.
Okay. Thank you, Sergeant Hart. So if it's all right with the committee, I'd entertain a motion to table this with the idea that we would try to come back in about 6 weeks, see if we've gotten any additional information about potential funding, potential locations, or alternatives.
Motion to table.
Okay.
Second.
Motion is made to table, not debatable. All in favor?
Aye.
Aye. Opposed? Okay, so we're gonna table that for now, and again, I'm gonna look at probably the third week in February to see if we can't take it back up and see if we've made any progress in terms of that. I'll entertain a motion to take up item 2.
Motion move item 2.
Second.
Okay, all in favor? Aye.
Aye.
Introduced by Councilor Todd McGee, ordered that the Public Safety Committee invite in Aumani Harris from Boston Medical Healing Communities Study Coalition in order to have a discussion about Naloxboxes as a way of reducing fatal opioid overdoses. So I know Ms. Harris is here, and I'm trying to find her. Okay, I see her there. Okay. Councilor McGee, it's your order. Would you like to start? And then I could recognize Ms. Harris.
No, I think we started. I know Sean gave us a brief update on it at our last meeting. We tabled it because Ms. Harris couldn't make that meeting. So with her here and due to the length of the agenda, I'd like to turn over to her to respect other people's time. So
Okay.
she's here, so I want to thank her for being here, and I'll turn it over to her.
Okay, Ms. Harris.
Awesome. Thank you, Counselor McGee, as well as Counselor Murphy. On the behalf of the Healing Community Study working in Holyoke, I want to thank you all for inviting us here to talk about the purpose of Naloxboxes being implemented in Holyoke in efforts to reduce opioid overdose deaths by 40%. And listening to the first two or one agenda items, I kind of really don't know what we were talking about there. It seems like homelessness is definitely an issue that we are addressing on the coalition, as well as substance use disorder. And I've had the great pleasure of working with the city of Holyoke for only about a year now. And through that process, when I first met with folks about a year ago, they mentioned, we're going to be implementing programs to help folks reduce opioid overdose deaths. Homelessness and community benefits are definitely something that promote long-term sustainable recovery for folks who are dealing with a substance use disorder. So I just wanted to say that and acknowledge that on the coalition, we are actually a partnership with a lot of folks who are on this call, like Mayor Morris mentioned, who have done tremendous work addressing homelessness in Holyoke, as well as the opioid use disorder, like Tapestry. The Sheriff's Department also works with us. Detective Beeben and Detective Immaterial are on our coalition, even the Springfield Health Department. And I want to give a shout out to Alex Wally, who also is on the call today, who works with Boston Medical Center, as well as the Department of Public Health, and signs the state standing order for naloxone for distribution through referral and the pharmacy. So the Healing Community Study, like I said, we can go on and on and on about the study, but I really want to focus on the purpose of Naloxboxes being implemented in the community. And the objective of this conversation is just to introduce that and then to check in with the council committee members to see if they have any questions regarding naloxone. And so we know this will be the first of many conversations. And so we just want to meet the council members where they are in terms of understanding the purpose and the use of naloxone. And then kind of go from there. And like the coalition, what we've been doing for the past year is to work with the community to implement these evidence-based practices, and that the study's really not looking at the study's really looking at how a coalition and a community of folks can come together, partner, and collaborate and implement strategies that we know that work, that best suit their residents in their community. And the coalition, I've been humbled to work with them, and I'm actually going to pass it off now to Rafael Rodriguez, who is the coalition coordinator, who's actually hired by the community, from the community, and I've had the pleasure of working with. And so I'll pass it off to Ralphie.
Okay, Rafael.
Thank you, Aumani. Thank you, councilors, for graciously inviting us again to present to you on Naloxboxes being installed in the city. I come to you as someone who identifies in being in long-term recovery myself. I for many years struggled with opiate use disorder, and and bringing that knowledge to the coalition and bringing that experience, I am able not only to speak to the benefits of naloxone being administered or being readily available. For myself, I wouldn't be here today if someone didn't administer this life-saving medication for myself and be able to advocate for others in the same situation as I was many years ago. I want to highlight some of the things and really get down to the crux. Aumani was saying this is a community effort. So our coalition is made up of various community-based organizations, like she mentioned, Tapestry, Hope for Holyoke, the Sheriff's Department, the Mayor's Office, the Police Department in Holyoke, Action Ambulance, many folks on our coalition, and Holyoke Health Center and Holyoke Medical Center, amongst many others. So this is really a community-based decision. When we were approached on developing strategies, this was one of the strategies that our community kind of came together and galvanized around, on the necessity of kind of first destigmatizing naloxone and making it known that everyone can be a first responder. And other things that we have chosen within our community as a coalition are things as tackling transportation barriers by providing funds for a van to be able to bring people back and forth to MAT or detox or initiating MAT and retention as well. Things like funding an addiction counsel service at Holyoke Medical Center to kind of streamline the process of starting people on MAT, working in partnership with Judge Hadley and the HEART program that he developed, and kind of having on-site, accessibility to treatment right there at the courthouse without waiting for intake. Just having it right then and there as soon as the person says, I am ready and willing. And amongst other things, we hired overdose prevention outreach worker at Tapestry. We were able to help fund that as well, and to reach the most marginalized and populations out there as well. With that being said, there's a couple other things that are on the horizon. We are starting to implement, and most of these are implemented as of January. And we're looking forward to seeing what comes out of these community-based strategies that we kind of put together and see how they work. And we're excited to follow the trends and see if we can really make an impactful difference in our community of Holyoke. With that being said, I'm going to pass on to Pedro, where he can speak to more why Narcan.
Thank you, Ralphie, and good afternoon, everybody. Thank you for having us here and hearing us out. A lot of familiar faces, some hope and get to know a little better. So my name is Pedro Alvarez. I work at Tapestry. I'm the Assistant Director for Urban Drug User Health and Outreach. I'm also a CAB member representing Holyoke out of the Healing Community Study. And I came to talk to you guys about Narcan and the importance of it. Working at Tapestry, we can easily give it out and have it available for anybody that wants it. We provide trainings as well, but it wasn't always so easy to obtain. I'm a long-standing Holyoke citizen. I'm resident. I've been living in Holyoke for nearly most of my life, and I grew up in the flats. And again, like growing up, Narcan wasn't so easily available. You didn't even know what Narcan was. I've seen, overdoses and being plagued with overdoses in the city. It's not a new phenomenon. I've seen my first overdose when I was 13 years old. Granted, it's not at the scale that it is now and what we're facing in the city. But the importance of having Narcan readily available. I myself responded to numerous overdoses, but I'm not here to talk about that today. I'm also here to talk about a story, a coworker of mine just happened to be on his break, goes to cash his check to a liquor store in Holyoke that cashes checks. A group of people kind of hanging out outside. There was a little commotion about something happening in the alleyway, and it was somebody overdosed in the alleyway. Nobody had Narcan on him. Luckily, my coworker was on his lunch break cashing his check and carries Narcan on him. He was able to administer Narcan. 911 was called, but the average time for 911 response is about 7 to 12 minutes nationally. So he was able to respond to the overdose, administer Narcan, administer rescue breathing, called 911. 911 did show up. Detective Beeman was actually on the scene. She's on this meeting here today.
Yes, she is.
Yeah, the ambulance was there as well. But it was a great effort. But the fact that my coworker was there at that moment, at that time, to administer the Narcan and respond to this overdose, because when somebody's experiencing an overdose, time is of the essence. The lack of oxygen that's getting to the brain could potentially lead to brain damage and other complications. Where the overdose could have turned fatal, if not acted on accordingly.
Could I just ask a question, if I may?
Yeah, of course.
To all, I mean, I think I understand this, but I'm not positive. So a Nalox box would be, I'm assuming we would have multiple ones throughout the city and not just one or two locations.
That's the goal.
Yeah, and that they would be, and let me also, I think we need to emphasize this. The Nalox box is not something that somebody gets high on. It's
No,
only
no.
it's only to save somebody from.
Yeah, so
an overdose.
naloxone, the only effect naloxone does, and we hear.
So there's no benefit of somebody going in there and trying to use it.
No, it only
So
works
I think
on
I
opiates.
think we need to make sure the public understands that as one of the things, because it's a goal of saving lives, not of doing anything other than that.
No, you can't. There's no effects of feeling high when taking Narcan.
Okay.
The only thing that Narcan does is enable the person to start breathing again. If they're experiencing an open overdose.
I know the order is to talk about it, but I'm assuming the goal would be let's get boxes in. I mean, I saw a statistic the other day from Sergeant Hart, and I think we had overdoses in Ward 1, and it was, I think it was more than 100 last year. So obviously we would need Naloxboxes in Ward 1, but it's in all wards, so it can't be just.
It's in all wards. It's in all communities. It's in all wards. It's not just Holyoke. I'm hoping, we start here with Holyoke and we get boxes up throughout the city. First, we can start with public places, branch out into private areas as well. And hopefully it starts a ripple effect and other communities start to implement Naloxboxes in their communities as well.
Okay. Councilor McGee, it's your order, and I'm not trying to cut anybody off because I think this is important, but I hear the goal here, and I am all for the goal. I mean, I have no problem if we can put boxes that are going to save people's lives and give people a chance to go get treatment and give people a chance to get rehab and give people a chance to have a quality life. I'm right there. And Councilor McGee, I know it's your order, so I'm going to turn it over to you. And we just get an explanation, but Councilor McGee.
Thank you, Chair. How this all came about, just so everyone knows, is I received an email from Ms. Harris saying, is there a way we can get before the council to, kind of go through this, get an update and get the information out there, file the order to get the person in here to start that. And that's why we started this discussion. One, what is it? How does it work? How will it be implemented? Where? All the things that we need to know. But first is to know what it is. And I think we got a good understanding what it is and the importance of it. Now, the real issue is we got to put a plan in place. I'm not going to speak for others, but I mean, the importance is we want to protect people's lives, and that's what this does. Now, how do we implement that? Where, everyone will say, well, you can have one in City Hall. Well, City Hall is one location. Where else? Ward 1, where in Ward 1? How do we do it? So we need a plan. And then we got to start answering questions with that plan, which is, once the box in, how long does it stay? How does it get replenished? If it's used, is there accounting for it? These are all the things that we have to categorize and then implement that plan. I'm sure you guys already have that ready to go. And that's something that we need to then now start acting on it. So, I see Ms. Harris nodding her head. I turn that over to you. If you have that information, can it be provided to us to then start working on it?
Ms. Harris?
Absolutely. Thank you, Councilor McGee. And actually, I'm like exploding with excitement right here because everything that you mentioned, we've been working on as a coalition. And really, that's the joy of working on the Healing Community Study is the coalition of community folks who are developing this plan. And the ask really for the council and this public safety committee really is that you would help us in that process in developing that plan to implement it in the city of Holyoke. We've met with a neighboring community. So New Hampshire has implemented Naloxboxes. We've sat in on their presentations about how they work with their Board of Health and their city councilors. And also the key piece is the community organizations where the boxes may go to create this partnership and collaboration for when the boxes need to be refilled. What's the standard operating procedure for when the box is being filled, refilled, what's in the box, where's the best place to put the box. So the OE&D group, which is Overdose Education Narcan Distribution, which is a subcommittee of our larger coalition, has developed a plan. And the way we thought about identifying location is actually using ODMAP. And so we get some ODMAP data from Action Ambulance, I believe, and a few of the stakeholders on this call are they have access to the ODMAP to see where the overdoses are happening. And then on top of that, what time are the overdoses happening? And so the place of location based on impact, feasibility, and accessibility based on overdoses for the data that we've collected. Becky Smeltzer, who's actually on the call as well, who is also a resource from BMC to the community of Holyoke as a community data manager, who is working with our implementing organizations to collect data as well as look at data to say, okay, who are we reaching with our interventions? Who are we not reaching with our interventions? And that the Healing Community Study really wasn't coming into Holyoke to implement new strategies, but to complement what was already happening and looking at the gaps and how we can kind of close those gaps up. And so again, the ask is that this Public Safety Committee will join us in that plan to implement and strategize how to implement the boxes in a way that is going to be impactful, accessible, and the most effectiveness for the community of Holyoke.
Mr. Chairman?
Councilor Graney, and then Councilor Juan Anderson Burgos.
Just a quick question regarding the boxes. Is there any security measures to make sure that nobody tampers with the boxes that shouldn't be doing that?
Yeah, so all the boxes, so there's different models of the boxes, and that is something the Public Safety Committee can discuss as we go through implementation. Just want to say the Healing Community Studies funds would pay for the boxes, and so whatever kind of boxes we want to implement, we can explore that. Hampshire Hope also has a grant to put 50 boxes in Hampden County, and so we have a resource of where to get those boxes as well. And so it's really discussion of with the group about what kind of boxes we want to put in. Some of them do have alarms, some of them don't have alarms. And then again, it's really that partnership and collaboration of the organization in which we place the box to know when we can go in and refill the boxes. So that way, when an emergency is happening, that it is available.
If I may,
yes,
if I may,
yes,
I just want to add to that, you know, the goal is to have it accessible. So it's not essentially going to be locked, but I can hear a concern around, like, if a child touches it or anything like that. You know, you just want to know if the overdose or the administering this Narcan isn't not going to hurt anyone if it isn't an overdose, right? So if you see someone that's passed out and you administer Narcan, and if it's not an overdose, you know, it's not going to potentially harm them. And so the goal is to have it accessible, ready to grab. If someone by chance walks by a box and takes it, we're going to assume that they need it, and they're going to need it, and we're going to come back within 48 hours and replace that.
Right. I was just concerned about the possibility of somebody vandalizing the boxes or doing something like that as well.
Just along that same lines, if I might, and again, I would like to think people wouldn't do that, but then again, I'm assuming the Nalox box or the part that is going to be used to overcome the overdose is in a package that is not tamperable. And therefore, somebody, you would not make a mistake and end up having somebody give you something that you don't really want to be doing, right? Okay. So they did answer that, how they're all in agreement. They are I'll call it the medication. I don't know if that's the right word. I assume it's probably considered medication, is secured and in package so that you can't damage it.
Yeah.
Okay,
so the medication, you can call it a medication because that's exactly what it is. It does come
Right,
in a secure package.
I would just be worried about somebody coming along, vandalizing the boxes or taking the medication and throwing it away when somebody that doesn't need it. I'd like to make sure that the boxes are secure to prevent anything like that from happening, so that they would be available all the time for the community.
Yeah, and we want that. We want it to be available at all times. And if people happen to walk by and take it, we'll come and refill it within 48 hours. Again, we want people to have it. We want to try to get it in as many people's hands as possible. And we're not just talking about drug users in the social circle. We're talking about all of Holyoke should carry Narcan. And that's what our goal is, and definitely getting that education piece out there and the importance of carrying Narcan.
Let me recognize Councilor Anderson Burgos.
Yeah, so Pedro said something I was gonna say anyway, but I'm gonna say it. So I carry this. Okay. I carry this in my car, on my person. It's a little packet. You don't have to be a nurse, a doctor, or anything like that. Self-explanatory. You can't get high off of it. This will potentially save a life. It could be a mother, brother, sister, son, daughter. You see what I'm saying? This is to save a life. And as far as in the boxes, my concern is this, not the boxes, that I feel that we should be implementing this on all the citizens of Holyoke, and not just Holyoke, Springfield, throughout the world, because this right here will potentially save lives. And maybe, just maybe, that if the person that you're saving wakes up from this, it's an eye opener. You know, it's a twofold. So it's as simple as carrying this. It's not deadly. It's self-explanatory. Again, you don't have to be a doctor. You don't have to be a professional. It's just read the instructions. It's like as simple as taking cough medicine, you know, and well, not, maybe not cough medicine, but you know what I mean? It's simple. It'll save a life. It really does.
No, I'm wholeheartedly in agreement with you, Counselor.
If I can,
Counselor.
Sergeant
Hart.
Sergeant Hart here. Yes, I spoke with the chief on this, and he is receptive to it. He just needs a little more information. He still does have some questions. I believe Northampton has them now. One of the questions is liability, not so much as administering it. We know we have the Good Samaritan law. However, if one's placed in the city hall and the public knows that, I'm sure we'll know where these boxes are placed, and let's say someone steals it and there's no Narcan there, and then someone overdoses in City Hall and goes for the box and nothing's there, is the city liable now? Those are some of the questions, liability.
Okay. I would also, I'm recognize Councilor Sullivan in 1 second. Oh, I did see his hand. I'm just going to assume that the boxes themselves are not left there for a month without somebody going to check to see what's going on. I'm assuming there's a regular checkup on it, right, to make sure there are some medication there and that nothing's been damaged.
Right, that's correct. Right. And Pedro mentioned, you know, someone would check the box within 48 hours, and working with New Hampshire, Northampton, sorry, I'm going skiing, and so I keep thinking New Hampshire.
Oh, well, now we know.
So they've actually worked with the fire department. So when they actually go in and check like fire alarms or AEDs, it becomes part of the regular check for them too, on top of normal checks. And so it's really, like I said, a partnership that will happen across the community. And it is just like administering first aid, CPR. It's just like that.
Okay. And right now we work in the community in partnerships with like I said, I work at Tapestry, but we also work with, you know, Sergeant Hart's program and Detective Beeman, Detective Emeterio, Hope for Holyoke Health Center, Holyoke Medical Center. The list goes on and on as part of the coalition of the HCS. So it's a team effort too. It's not like it's one person's responsibility to check the boxes throughout the city. I think again, it'd be part of the coalition, part of the team that's actually doing some of that work.
Thank you, Pedro. Councilor Sullivan? Unmute. There you go.
Yep. There you go. Sergeant Hart answered a portion of the question I wanted to ask regarding legal liability. And I think I understand the Good Samaritan part, where that would cover someone that was administering it. I'm wondering what liabilities the city may expose itself to. Is, for example, the person has a reaction to it and it's something that we're supplying. You know, you're administering a drug to save a life, but what if like everything else out there, what if there's a reaction to that drug which causes a person to die? Is this exposing the city to any other liability by putting this out there?
Mm-hmm. That's a great question. And I actually have Dr. Alex Wally, who's on, who can speak more to the science of Narcan and the liabilities around the state order.
Okay, Dr. Wally, would you like to answer that question?
Yeah, so it's true. Excuse me, my name's Alex Wally. I am a doctor, a medical doctor. I am not a lawyer. That was a legal question. I can tell you that no lawyer can guarantee you that you will not be sued in anything that you do with the city. And I would say that this is within the scope of of normal medical practice for sure, but also public health practice. These Naloxboxes are used throughout the country. They're recognized as evidence-based. And so with that comes not a guarantee that you won't be sued, but definitely protection that you can say that this is not outside of what a public health entity or an organization that's public facing and public serving is doing. I guess, again, I'm not a lawyer. I think your question was a legal one. I do have experience over the years at the health department in thinking about these medical legal issues from the medical perspective. And I can tell you that this is within the appropriate scope of medical and public health practice.
So, doctor, would you say this is pretty much kind of the equivalent, no different exposure and liability than having a defibrillator or something else like that out there on the wall?
Yeah, I think it would be very similar to a defibrillator. I think the chances that you would hurt somebody with naloxone are probably less than you would hurt somebody with a defibrillator. So yeah, it's very similar to that. I think it's safer and requires less maintenance as long as you have. Yeah, I will say my biggest concern, which I think has been addressed well in this plan, is that you're going to have empty Naloxboxes. And I don't think that subjects you to a lawsuit necessarily. I think that just would sort of undermine the public education purpose of it. And you have a strong community coalition that is supporting the maintenance of these boxes. So when people, you can't just place these once and then say your problem is solved. You do need to have an organization that's committed to restocking them, which I think you have here.
Oh, it certainly sounds like we do. Councilor Sullivan, you all set?
Yep, all set. Thank you, doctor.
Okay, thank you. John Gonzalez, Health Director.
Yeah, I just a quick question sort of on the topic of them being filled. As we're talking about encouraging people to carry them, is there going to be any information available for how people can access this so there's not a temptation to, say, empty a Nalox box in order to have it for yourself to carry, so that if there was an emergency, the temptation isn't to remove it to keep for your, possible future use and then possibly make it so that it's not accessible for someone who might need it in the moment?
That's a great question, Sean. And what we were talking about when strategizing how to implement this is that we want to promote the boxes as emergency use, just that emergency use, and that there are, XYZ places where you can get Narcan, where you can get trained on Narcan, refer folks to the state standing order, where you can go into any pharmacy, request Narcan, and depending on your insurance, it may or may not be free, but it is available. So that's a great question. Again, the ask is that the Public Safety Committee, if interested, would work with the OE&D subcommittee to develop this plan and answer those questions and have a standard operating procedure for when things like that happen.
Thank you. Mr. Mayor, would you like to comment on this?
Yeah, no, I would just echo what the expert said. Certainly something I support. The more public and private facilities and spaces we can get this in, the better. I think it's a not just harm reduction, but life-saving. And the more we can distribute this, the better. So I think City Hall certainly should be a model and be an example, but also encourage other, not just public facilities, but other facilities and businesses throughout the city to provide this as well, for employers to also train and talk about their employees. So if you're at Racing Mart, for example, on Main Street, and you notice something in the back alley or in the front parking lot or even in your bathroom that, the person at the register can get there. The person at Dunkin' Donuts is familiar and either has Narcan somewhere in the gas station or in the store to get it. So I think, that's sort of the next step of be a model and then move forward to engaging businesses. And we can track those areas of the city and where oftentimes overdoses and the calls for service are, to make sure that we're allocating resources most effectively where we're going to have the most where we're going to help the most and make the most difference. So certainly something I support and appreciate, Aumani and everyone here. And thanks, Raphael, for sharing your experience and for all the work you're doing. And of course, Pedro, all the work that you do on behalf of Tapestry. So
Thank you, Mr. Moore. So if it would be okay with the committee, I'd recommend that the order's been complied with, but that in that complying with it, we also recommend that the city move forward with implementing the installation of Naloxboxes based on the evidence as to where the overdoses are taking place the most, and trying to make sure that we potentially save some lives. So I'll entertain a motion. It's been clapped.
So moved.
Okay. A second on that?
Second.
Okay. So we're basically recommending it. We're going to say that the order's been complied with because there was an informational order, but that we are recommending that the city move forward, working with you to establish the location of the boxes and provide training and work with the opioid task force and the ambulance service. And I want to thank the people from the ambulance. I don't know, well, I should probably, before I go there, I know I've got several people from the ambulance, Action Ambulance. Are you, I'm assuming you're in agreement with this, but I should ask before I make that assumption.
Counselor, it's Frank.
Yes.
Certainly, we'd be in favor of anything that helps anybody in need. Sometimes our concern is, and I think Rock can speak more to this, is that, when these sorts of things happen and no one calls for an assessment of the patient, that's pretty key. And the other thing is, I think that the public needs to be educated about the amount of Narcan to give to people, so I hope that these boxes will have some kind of an instruction on them so that they don't give them too much. Too much is not good, and you really only want to just carry them over for a few minutes. Our average response time in the city is 5 minutes. So, we just want, to make sure that people actually know how to apply these things. And Rock, why don't you fill in on the rest of that?
Thank you. Thank you, Frank. Rock?
Yeah, I think thank you for the time and for having us. I think that
thank you for coming.
There's some more things to talk out as we go through, and I think installing these is a no-brainer. I think that it's life-saving and it's an obvious step for the city to take. I think there are some questions that we would probably have for Aumani and the team as this progresses forward. And Frank hit it on the head. We're seeing a lot of patients. We get called to overdoses. By the time we get there, the scene's been fled by the patient who received Narcan and took off, and we get candidates to assess them or get them to the ER where they have opportunities for further treatment or being placed. So little things like that we'd really like to hear more on their experiences and probably connect also with the fire department in Northampton and what they're seeing. But we'll talk more as we go forward. And to answer the question simply, we think this is a great idea, and there's some more steps to take for sure.
Okay, thank you. So if we can,
Counselor,
if I can,
Murphy, if I just may address Aumani, if you could email the fire chief, they're one of the first responders, and also carry the Narcan and would be part of our group and coalition. Just let them know and provide them with some of the questions and answers that we had here today, just so they can be on board as well. Thank you.
Thank you. So if we can, when we're doing this, and I think everybody seems to be very excited and pleased that we're trying to do this. So I think, again, on the box itself, not only the instructions on how to use it, which I'm assuming are there anyway, but also the idea that even if you're using this, need to call 911 right away.
Yeah.
So that we're getting the maximum benefit out of that.
If I could just say something real quick on that.
Yep.
So all the Narcan kits, even the ones that will be put in the boxes, they will have like a trifold instructional on how to use it. It provides literature, it provides little graphics that kind of show it as well, both English and Spanish. In these kits, there will also be the Good Samaritan cards, stressing the importance of calling 911. Believe me, we understand that people might need the further evaluation right after. It's a benefit of actually going to the ER, maybe hooking up with a recovery coach in the ED as well. There you go. Juan got the cards there. And also an opportunity to provide trainings. Sean asked about maybe somebody seeing the kit there, not wanting to take it, but need a kit for themselves. There'll be information there where they can obtain a kit and obtain a training as well.
Okay.
So all
So
that would be
take it out of there. You would provide it. Okay.
Yeah, of
sounds
course,
great.
definitely.
Sounds great.
Lastly, I just want to give a plug for Erica, who's actually hired by Tapestry through the Healing Community Study because the coalition's seen a need for more street outreach. And so Erica has been hired to do just exactly what you all have been talking about, reaching out to businesses and individuals, families, parishes, you name it, to provide Narcan training, as well as education on harm reduction and the purpose of that. And so Erica's going to be doing a lot of street outreach as well as trainings, like I mentioned. And so if you're interested in that, you can also ping myself or Raphael for more information on that.
Okay, thank you very much. And lastly, Councilor Anderson Burgos, and then we'll vote on complying.
Yeah, so I can't stress enough on the education portion of this conversation that we're having, because seriously, me being an addict myself, and can you imagine, had I continued on that path, I wouldn't be here. I wouldn't be who I am today. I mean, it's changed my life. I'm thankful that I've never gotten to this point, but I know there are a lot of people who suffer out there like I was, and education is what got me sober. Education. We reach out to the community, we help them as much as we can, and eventually they'll start listening and they'll get it. I did, and we just have to put our best foot forward and just try our best and help these people as much as we can, and it'll turn around.
Thank you. So the motion on the floor is the order has been complied with, that the committee is recommending the council endorse the installation of Naloxboxes throughout the city and work with the city to put that into actual implementation. All those in favor?
Aye.
Opposed? Okay. So 3-0. The committee's pretty strong in favor. So we thank you for your time and your input, and thank you for your concern for human beings.
Thank you, everyone.
Thank you. Good night. So we'll take up item 3. I'll entertain a motion to take up item 3.
Take up item 3.
Okay. All in favor?
Aye.
Okay. And we've already done it, so I'm going to move this pretty quick. So order that, and it's introduced by myself as well as Councilor Lisi and Councilor Hernandez. Order that the mayor and the health director appear before the Public Safety Committee to provide an update on the potential for the city to establish a homeless shelter potentially at the War Memorial Building. As you all know, we've had conversation early on here, which dealt with Motel 6 and Dean, which is going to provide some homeless shelters through beginning of April. So if it would be all right with the committee and all right with the mayor and the health director, I would suggest that we table this again, coming back as we get into late February, and we have a little more idea as to what else is going to go on and what the alternatives might be at that point. Would that be all right with the committee?
Yeah.
So moved.
Second it.
And just real quickly before, Mr. Mayor and Mr. Health Director, would you both be okay with that? We would just be tabling this and taking it up probably in the meeting in March, since we are going to have the other two homeless situations going on until April. And since I'm not hearing from either, okay.
Yeah,
so
they put their thumbs up. They said,
yeah. I got so many people here, I'm not seeing any thumbs up. I did see 1 or 2 before, by the way, but I didn't know what that meant. I mean,
You can't see the blue hands.
I won't go there, but the motion is that it be tabled. All those in favor?
Aye.
Opposed? Okay, we'll table that. I'll entertain a motion to take up item 4.
Make a motion to take up item 4.
Okay.
Second.
All in favor? Aye.
Aye.
Okay, introduced by Councilor Hernandez and Councilor Tallman. Ordered that property owners for 287, 291 Elm Street, Carrie and Arthur Nats, have reached out to possibly collaborate with City, Holyoke Police Department, or the landlord, such as Tony Fasoni, that owns 294, 298 Elm Street, and buildings on Walnut Street adjacent to 300 Walnut Street in the pursuit of installation of surveillance in an attempt to combat overall criminal activity, drug, human trafficking in these areas. I have full contact information, and we have contacted. And I took the liberty of also contacting other landlords because I would, and I don't know this, but I wanted to make sure that if this is happening in those buildings, is it also happening in other buildings? In which case we need to have that kind of discussion. So there are other landlords that have agreed to come on here. We did have a long discussion at our last meeting and talking about tenants being abused, tenants being threatened, being blackmailed. I indicate almost being kidnapped. So there's a lot of things that have gone on. So one of the concerns and one of the thoughts at that point was to potentially install more cameras, and we've invited Jim Lavelle from the Gas and Electric to talk about that as well. I'm going to just kind of open it up, and Carrie, I'm going to let you start because obviously you were the one that brought this forward, and then we can kind of go from there. Carrie, I think you're still here, right? Nope. Okay. Okay. I know she was just there, and I think I lost her. Jeffrey, can you check to see if she got disconnected?
No, I'll send her. I'll send her an email and
okay. Okay. And if there are any other landlords or any other tenants that wanted to speak up on this, if you can let me know, I'll try to recognize you. Anybody put a hand up or? All right, then let me go to Mr. Lavelle from the Gas and Electric. So, Jim, one of the concerns was, and we had the police chief with us, and he had a personal issue that he could not make today, and one of the concerns was the cost of upgrading the camera facilities. In this particular case on Elm Street between Hampshire and Sargent. And then on Walnut Street between Hampshire and Sargent, and trying to create a better image, I guess, for the police department to be able to recognize what's going on and also be able to react to it. And the cost was a concern.
Thanks, Counselor. Yeah, the installation of cameras is not cheap at all. I think the police department reached out to Valley Communications, who's been providing the hardware for most of the camera installations. Just their hardware proposal and necessary support was, I think, right around $40,000. And then, our involvement is just getting the cameras connected to the city network. So, mounting the cameras, in addition to the $40,000 for hardware, just to install the cameras, program them, connect them to the city network, run fiber. In this particular installation, there's replacing 2 existing cameras and installing a third one on Sargent Street. And just to remove, install, bring the fiber to the cameras and connect it to the network and do the programs, another 13. So you're talking for 3 cameras, a little bit over $50,000. So it's very expensive.
So 50,000 on your expense plus the 40,000,
$90,000. No, it's 40 for Valley, and then it was just, I think it was just over 12.
Okay.
Because our involvement is all out of pocket too, because we hire contractors to do the installation. So it's not like it's HG&E line trucks and others that are doing this. We bring a fiber splicing company in. and a mounting company, and so it's electrical and fiber splicing work that's out of pocket for us. So we pass through just about everything on our end, but except for the out of pocket.
Okay. Is Sergeant Hart or Detective Beeman still here?
Yes, Sergeant Hart's here.
Okay. So, and I know when we had the discussion, I'm not sure you were here. I don't think you were here at the last meeting, but I mean, part of it was, you know, the people causing problems were leaving everything. They were able to get into the doorways without anybody being able to stop them and all those kind of things. So I'm not a techie. I have no idea how all this stuff works, but I just looking to see if there was any way, if we were to be able to put something, if you will, where it's on that person's apartment building, and I don't know if that would work, or it's above the building, where we can know that they've got the carpet in the door, so that they're having somebody coming in, and I'm assuming they're coming in to buy their drugs.
Yeah, there's been, I know some of the owners have tried some different ways to prevent access to those apartments. They've used the keypads. Eventually, residents give that code to the drug dealers, and so they have access. One thing we did do, and it was paid for, and again, like the cameras, it's expensive, but we did have a zero tolerance detail over at 5 Spring Street, and I know we had a big problem there, and it didn't take long for the word to get out, along with trespassing signs, for the drug dealing to kind of move out and relocate to other areas, whether outside of the city or inside.
Is that 5 Adams Street or 5 Spring?
Yes, 5 Adams.
5 Adams. Yeah. Okay.
Yeah, so that was really the only successful one. I know Elman Appleton.
Yep.
They implemented the steel doors, but they're back at it there. So.
Yeah, I know we get a lot of calls, right? I mean, that's your number one call corner.
Yeah, that's one of our hot spots.
Yeah. So, if there was a trespassing, no trespassing, we'd be able to get those people out of those buildings and actually arrest them, or what?
Yeah, well, what takes place is we get a list of tenants in each apartment place. We'd get keys to both the front and back doors, so we have access, and anyone coming in would be asked who they're visiting, and a lot of times we get a first name and they don't know their last name or anything else. So a lot of times that's enough for our officers, along with some other elements, to make an arrest. And once you do that so often, it starts to affect the drug trade, and they do leave that location. So.
Okay. All right, Councilor McGivern.
Thank you, Mr. Chairman. John, thank you again for being here. I'd hope the landlords were with us that were with us the last time, and the chief. But I was looking for an update on what the Holyoke Police Department has done since then to curtail this activity. You gave me some general ideas, but can you tell me how many? Is there a cruiser that's been dedicated to this area? Is there been a logging of the calls and the response by the police department since the last meeting?
I know really with all we have is grant funding to do patrols, and those are the hot spots.
And you got a $12.5 million budget. I want the chief and the police department to start talking about what you don't have and talk about what you do have for resources.
Right, and that's one of our resources is the gang suppression unit and the mobile community policing, where we did conduct patrols in all the hotspots throughout the city.
So can you give me a list of the responses to this particular addresses?
Yeah, I can come up with some of the reports from those mobilizations and pass it on to the council.
Thank you.
You're welcome.
Are there other landlords that I would like to hear from if you are here?
Terry, I'm here.
Okay, go ahead, Mike. I'd like to know if we got other issues that are similar. I mean,
I mean, so it's kind of a status quo. I will tell you, street cameras are problematic because not just of the cost, but of the monitoring and the capacity to, access information later on. From our point of view, we have them in our largest building, and it's seldom fruitful. You don't catch what you need. We watched one time with some guys carrying a TV out of our community room, and they just angled themselves so they covered their faces. And, so we looked at a bunch of literal hoods carrying a TV out. It was absolutely no value in terms of trying to find the TV or the people who did it. The drug dealing in that particular area is obviously our biggest concern at all times. It's an area that has open air stuff. This time of year, our greatest concern always is invading our hallways and operating from inside the building. And the only solution is when we get tenants who are able to advise us that it's going on and give us enough information. And then, the police department has been very effective, just as Sergeant Hart had described, to gather the information, gather the evidence, and make the arrest. So, and it's a temporary fix. Right now, I don't have any indication of active drug dealing in the two buildings we own in that immediate neighborhood, but certainly there's indication that there's drug dealing in the area, and it will be back in our building. It's just that's not an if, it's a when. And we just have to be constantly poised to deal with it. Technology is no substitute for good communication with our tenants. That's been our experience.
So, and obviously the ability to work with tenants, but when tenants get intimidated, I'm assuming tenants tend not to say anything when they think they're being threatened.
That's absolutely correct. And not just a threat. Sometimes they actually have friendly relationships. These are not necessarily folks who are aggressive or terrible neighbors, and they want to get along with their neighbors. And as long as they keep it to a dull roar and don't threaten them, we've experienced where there's tolerance. It's when it becomes threatening or violent, or you just get that. We just need one tenant who doesn't want that in their home, and we get some information, but not necessarily immediately.
Councilor Tallman?
Thank you. Thank you, Mr. Chairman. I appreciate it. As a co-sponsor of this order, I think it's important, as Councilor McGivern stated, I'd like to see the police, the routes that they're taking during the day in certain areas, especially this neighborhood. And I don't know if there can be any funding put together for some kind of grant for cameras in that area and those blocks, but I think that's important too. And also sort of neighbors to stick together, like sort of like a neighborhood watch for these areas. But it's difficult that people have to live and see this on a daily basis, the drug dealings and the crime, especially in that Walnut Sargent Street area. So I think it's important that we get a better police presence in that area. And if there's any way, it's costly as Mr. Lavelle stated, but there's any way that somehow we can get the money from somewhere to try to get the cameras put in those blocks. I think that is really important for the safety of the residents in that neighborhood. So thank you.
Thank you, Councilor Tallman. Are there any other landlords that would like to talk about how things are going in their buildings? No? Okay. so if I can get back to Mr. Lavelle, Jim, so we already have some cameras, I think, on Hampshire Street, if I'm not mistaken, facing towards Elm Street. So if we were just to put one on Sargent Street to try to provide, I mean, maybe there is something there, I don't know, but with more high definition, would that make a difference or no?
I'm probably not the best one to respond on this. I think that, you know, the HPD people, Officer Borrego, I believe, is that correct, John?
Yeah, yes, it is. And we do have one camera on Sargent Street and meet right at the corner of Elm there.
Okay.
I think it's one pull up a little bit. But we could use one. There isn't one on Hampshire and Elm. So we could use one from that direction.
So if we were just installing
and
one, what would the cost be?
Well, we've been kind of piecemealing them through grants through the years. I don't know. I think Jim just said 50. So divide that by 3. That's for 3.
Yeah, it's kind of a linear function. So it would probably be about 15 or 20 for one, unless there's fiber right there and you're, we have quick access to the network. You could do it for maybe somewhere between 10 and 20,000. And yeah, I think, you know, there was a group, the HPD worked with Valley Communications to, you know, pick locations based on what they were trying to observe and end up with data and evidence. So there was, you know, some thought put this. I mean, access to poles and other interference plays into it as well. But I would, to your point, you know, something is, I think, a little bit better than nothing as a deterrent. But even one camera still costs a bit of money.
Yeah, but Sergeant Hart, in terms of responding, cameras do assist in terms of quicker response.
Oh yes, they helped solve and close quite a few murders
Okay.
throughout the years.
I mean, again, we know we got a problem in this area. I mean, I was just astounded at the or dangerous situation in those buildings for tenants. Whatever, if we can do something that's going to, and if it costs us 15 or 20,000 to be able to get a camera that's going to help accelerate the police response and get rid of some of these bad elements so that people can live in their apartments without fear, that's $20,000 well spent. And I know people say I spend money freely, but I mean, you got to have a quality of life. And if that can help, then I think we need to do it. Councilor Tillman, your hand was still up?
All set.
Okay. Would anybody else on this? And I think I lost, and I hope I lost Carrie, and I'm not sure why. So anybody on the committee would like to make entertain a motion? I'm suggesting that the order has probably been complied with, but that we ask for a follow-up in terms of the G&E and the police department working on establishing, putting some camera situation up on Hampshire and Elm, or at least trying to look at and give us a report as to whether we can do that. And then John, if we can, Sergeant Hart, if we can just get maybe a report back to the Public Safety Committee in maybe 30, 45 days as to how many times the police have had to respond to that area.
Okay.
That'd be okay?
Yep.
Councilor McGivern, Councilor McGee, would that be okay?
Councilor Tallman has a question.
Councilor Tallman, sorry.
No, I think when you're going to close things out, Mr. Chairman, I think Mr. Williams wanted to say something.
Oh, I'm sorry.
Mr. Williams?
I think you guys are overpaying for the cameras. I mean, I can't understand how you could be spending $40,000 for one camera. I mean, I have over 30 cameras at my place.
Yeah.
And they're great quality, and it could be done by some tech person on you. There has to be somebody there that can do what I do. I do it and run my business. So it's kind of sad to see that you don't have the cameras that you need because you're paying too much for them where you're buying them, probably.
Okay, thank you. So
there are a lot of things available that you can buy that are very good quality.
So if we could look at that, Mr. Lavelle, if we could look at potentially finding if there, and maybe we can work with Mr. Williams and see what he does and see if there is potential for less cost. And I mean,
Yeah, we looked into that, and a lot of those less expensive cameras aren't really compatible with the system that we have.
Okay.
With the G&E, and they're not fiber optic run.
IP cameras are kind of the norm. You could go to a web browser and pick them up. They have programs that you can gather 60 cameras on one computer. It's very, very. I'd like to show one of your tech people what you can do for a lot less money. If you want to see it, I'm just offering that to you. If I could show somebody, I think it might save some lives and save a lot of problems for you people without spending all that money for nothing.
Yeah, and I believe we can relook at that issue, but I think at that time was it had to do with those are all Wi-Fi, and these are direct optic links, so it's least likely to have any disruption in the camera itself.
Yeah. These run on the regular CAD5 wire, or they'll also run on Wi-Fi. I do not like the Wi-Fi. The CAD5 works very, very well. There has to be some kind of a tie-in to fiber for those. A lot cheaper than $40,000.
Okay. Well, Mr. Lavelle, if you can potentially look into that, and Sergeant Hart, if you guys can coordinate and see if there is a cheaper way that we can do it that's effective, then let's look at that. If there's not, then we need to look at one way or the other. We need to look at trying to improve the safety and the police response on that block with cameras on Hampshire and Elm, so that we have basically a full recording of Elm Street from Sargent to Hampshire.
We'll be happy to. I know it's, as Scott points out, we know that there are cheaper technologies out there.
Yep.
They've evolved to an extent where they're now compatible with some of the equipment that really runs all the data that's being captured. So we're happy to do that.
Yeah, no, I appreciate that. And again, if you check it and you can't do it, then that's the way it is. But and we just, again, the goal here is to try to bring a quality of life to those people that live there, and the landlords that are trying to maintain their properties and trying to keep their tenants safe. So I'm going to entertain a motion that the order has been complied with, that we are looking to see if we can get a camera installed at Hampshire and Elm Street, and that we would get a police report of police responses to the area on Elm Street between Hampshire and Sargent within 45 days. Okay. Will I get a second on that motion?
I guess my only response to is the complied with. I mean, we still need the cameras. We still need the report. We still need to kind of address the issue that is still looming. Okay. So I'm not sure it's complied with. Okay. If they're saying I'm gonna put up cameras tomorrow, we have the funds to do that, and the shifts will now be X, Y, and Z, then it's complied with to me. I think we need to do a little more.
Okay.
I'd say table it until we get that report back, and until we get the answers to more cost-effective cameras, if that's available. If not, then what way can we do to get the cameras installed to address the problem? So to me, I'd table it until I get those answers.
I think Councilor McGee is correct, Mr. Chairman. It's not complied with, and I don't favor expensive cameras. I think cameras are a deterrent. I think Mr. Williams has a great idea, and I think even some of the landlords would want to hear from Mr. Williams as to what they can do. I know a lot of property owners have put up their own cameras and then work with the police department in terms of, this happened and can we do something about it? But I'm really interested in what the police response has been to this situation. And Sergeant Hart's correct. They'll make the effort, they'll make the response, and it just moves to another neighborhood. And what do? Move the cameras to another neighborhood? We can't put the expense on the gas and electric. That's not fair to the ratepayers. Can't put the expense into the police department, who has to work with the hardware that they have, but there's got to be a way that the police department can be a deterrent and do some good old-fashioned police work and break this nonsense up.
Okay, so the motion then is to table it with the idea that we are going to look at potentially installing cameras on Hampshire and Elm Street, and we're going to get a report from the police within 45 days as to activity and arrests that have taken place in that location for those 45 days.
Second.
That's pretty much what we want.
Yep.
Okay, all in favor?
Aye.
Opposed? Okay. I'll entertain a motion to take up item 5.
Item 5, take it up off table.
Second.
Okay, all in favor? Aye.
Aye.
This is introduced by myself, Councilor Tomlin, Councilor LeBron Martinez. Order that the HD&E examine the possibility of putting lighting which would shine into the alleyway between High and Maple Streets, one from Sargent Street and one from Hampshire Street. If that is possible to do without causing lighting to shine into apartments or homes, then please install at the earliest convenience. The alleyway has had some serious concerns with trash dumping and drug usage. If I can real quickly just say, Mr. Williams on one end, on the Hampshire Street end, and Mr. Moriarty with property on the Sargent Street end are both more than willing to work in terms of where the lighting might be installed. So I'll start with that. And Mr. Williams has been already before us, knowing that he's working with the police in terms of cameras. This would be another potential in terms of lighting and making his side of the alley better. Mr. Moriarty, who just got his own change approved last night, has already indicated he also agrees with the need on Sargent Street to light up that alley. I mean, there's a lot of bad things that have taken place there, and we need to make it as much a deterrent as possible. So that's the goal behind the order. I'll entertain any comments. Mr. Moriarty?
Sure. So, one thing that may be helpful just logistically is the layout of the alleyway. If you're not familiar with that immediate area, we've got a building that faces Sargent Street, and it's got a 4-story brick wall that comes in from the alley, just parallel to the entryway. We would have no problem giving a license or whatever other authorization is necessary to affix lighting on our building. We obviously need to have it going into the alley and not, into the living spaces of anybody in the immediate area, and to be at a height that's comparable to a street pole, so it's not able to be attacked by anybody. We've got a next door neighbor who's been a great neighbor. His name's Marcos Garcia. He owns another 3-story house next door. We're doing a transfer with him shortly. He's going to be making some improvements on the side of the alleyway where we're located. And so it just seems like it may be a good moment to put some lighting there for a longer period of time. And if it's a low enough cost, I mean, we'd even not object to putting it on our meter, because obviously we benefit from it, but we would have to have some sense of what that would mean in terms of the operations of our building. If there's a conduit there that would also allow us to add some cameraing, we would also not have any objection to buying a small system that could be recording in there. So,
okay, thank you.
Yep.
Mr. Williams?
There's some poles behind our building that would work out well. My building isn't tall enough to put any lights or anything like that on. So
okay.
Cameras, as far as cameras, I'd like Mr. Moriarty, if you would like to see how it works. I mean, the camera systems have come a long way with the IP cameras.
We actually have something very similar to what you described in our largest building. The only complaint I've ever had with them is that we just find it's about, you have to anticipate everything. If there's, we want it visible, that's the deterrent value. But when it is visible, they always seem to find a way where you're not identifying anybody when something happens. And so, that's the frustration. We'd always hoped the camera system would help us actually catch a culprit. And, maybe it's deterred stuff, but like I said, we once watched the TV walk out of the building. So, you know, I've become a little bit cynical about their efficacy, even with a high quality system. And ours can accommodate up to 50 cameras and has really good resolution when you hone in, but you have to have the face on it to get where we want to be.
Have you thought about talking to the police department, because they have people there where they'll monitor the cameras for you, and it will help them around your neighborhood so they can see what's going on and looking for people that are hanging around and probably get people out that way.
Is that the case? That's a new development for us, because that had not been an offer made previously.
Yeah, the police department, I think if you can give them access to the cameras.
Oh, that's easy to do. Sure.
Sure.
Okay.
I think the camera system I'm talking about, I know for sure that I can get 64 cameras on it, and they're pretty good. You can buy them 2 to 4 megapixel cameras, and they zoom in with they're the physical zoom in without the, you can get them with the physical zoom in without the digital zooming, which is much better.
Okay, Mr. McManus, I see your hand up. Mike?
Yeah. I mean, we've got the Arlo cameras around the city in different spots. They're cameras you could buy at Best Buy, and they're connected with like a cell card. So whenever it detects motion, it's like the Ring cameras or other home security devices where you get an alarm on your cell phone. It's a web-based thing. So the camera, it senses motion or it senses audio. It starts recording. It sends an alarm. I got the alarm. It comes to my phone. So then I'll look at it and see if it's is it a bird or is it some troublemakers? And if it's troublemakers, then I call the police and they respond if they can. Those cameras were a couple $100 a piece. You do need a cell service, which is I think 30 to $50 a month per camera, and then they're battery powered, or if they're close to an outlet, you can plug them in to an outlet. These are the ones that we used up at the geriatrics, at the parking garage. We've got one at Pool. And they work as long as someone's watching them. Unfortunately, they all come to me right now. We tried. The fire department was watching them for a little while, but then something got wonky with the service, where it stopped going to their system.
Okay.
But that's what we use.
Okay, thanks, Mike. So, Mr. Lavelle, does this sound like something that the G&E could potentially do?
Yes, we can work with both Mr. Williams and Mr. Moriarty to look at what the best solution would be, because we could attack it initially with some street lights, which would be the cheaper option. And then if that is not adequate, we could look to see if affixing floodlights in the alleyway would enhance the solution. Just a couple of issues that we'll have to address. We have a street light that we had problems with right across from Our Lady of Guadalupe on Chestnut and Sargent, that it was getting shot out every other day, so we had to end up putting a bulletproof shield on that. That's been somewhat effective, but I suspect we'll have the same issues here. The other issue is glare, because it's hard to prevent the light. You want to light it up, but then people are trying to sleep at night. So we're gonna have to work to try to tweak that issue as well. But I'm sure we'll find a solution.
The one thing, and I think in this case, if they're in both cases, Mr. Williams, you correct me if I'm wrong, but the lighting would be going towards Mr. Williams' business and would not be going towards any apartment. So as far as shining into the apartments or anything like that, I don't think it would be an issue.
Okay.
So if we can, I think, everybody seems to be in agreement that this is something that's workable, and potentially, Mr. Lavelle.
Mr. Chairman, is it the intent of the order that the streetlights, if placed, would be on the budget of the city, or is that something, the intent that this is a solution funded by the property owners?
My first response to that is I just want it resolved. And
Okay.
I know Mr. Moriarty indicated he would be willing if to potentially pay a little bit. I don't know if Mr. Williams would also be willing, but you know, I think we got a problem, and it's a city problem, and I think lighting can help not eliminate it, but reduce the volume of it. So, you know, that'd be my. I'd be willing to pay some of that for sure.
I'm always willing to step forward within reason. The devil's always in the details. You know, what I would suggest, I need to know two things. You know, what sort of capital expenditures involved in fixing something we're building, and then what are the ongoing maintenance costs? Basically, what would the equipment you put on there cost on a year's basis to run? You know, I think the operational cost would probably not bother me very much, and the value to my tenants would make it worth it, even if I had to, you know, make a minor increase down the road. The capital improvements might have to come back and talk to you, Councilor Murphy, to just say, you know, hey, it's an upfront cost. It'll be there a long time. Is there, you know, some kind of resource we can look at?
Yep.
And if it's small money, I might not worry about it.
Okay. So, Councilor McGivern and then Councilor Tom.
I think lighting is important, and I grew up in a home that was on an alleyway, so I understand these issues way too well. And they're not just in this one location. I mean, our alleyways are outdated. If there weren't garages that needed access and utilities, that we needed to have easeways, you know, for them, I think it'd be time just to turn them over and let the owners shut them off, and probably be a lot safer. But unfortunately, we can't do that, and I think we have some responsibility for lighting. But the reality of it is the city council cut the city streetlight budget this past year. The mayor cut the request by 10, and we cut it by an additional $20,000. And I don't know if Mr. McManus is still with us, but
yes, he is.
You know, Mr. Lavelle can tell us how are we doing with keeping the streetlights that we have now on. Is the budget keeping up with the energy cost?
Jim?
I don't have the exact line item for streetlights current, but I think that the city's fairly current with its bills at the moment. I can say that.
Because the budget was $390,000, and to debate halfway through, it looks like we paid $231,000. That doesn't add up in my my old math. So I think Mr. Lavelle has a good question. You know, we certainly can endorse this, but there's a lot of miles and a lot of alleyways, and we're going to do it. We're going to have to do it across the board.
Well, Mr. Lavelle.
To Mr. Moriarty's point, I don't think any solution would be really subject to any capital expenditure. You know, most of the programs we have for contract lighting or street lighting are a monthly payment. For one light, you're probably talking around $10 to $15 a month, and for a floodlight, you're probably $15 a month.
So if we could do that and work that in there, and Mr. Moriarty and Mr. Williams were willing to just have that, we could potentially have that alley welded.
Yeah, I think so.
It's $1 a month for my apartments. That I do without any further hesitation.
Councilor Tom?
Yeah, I think it's important. Thank you, Mr. Chairman, as having that area lit up as best possible. And I know I remember seeing that certain, you know, people have lights on their homes, extra lights. The cost is very reasonable. So, you know, $15 or $20 a month, maybe split between the two businesses. I think to get 1 or 2 lights in that alleyway to keep that area lit up, and hopefully, you know, the lights won't get shut out or whatever, shut down. But it's important for the safety of the people in that neighborhood, and also for the businesses, especially Mr. Williams' business. And I know we were here about a month ago talking about the issues that he was having in that alleyway and with his cameras, and people doing things right there and you know, during the day even and at night. So any way that can be lit up and you know, the expense possibly drawn out between the two businesses, I think would be beneficial to them and to the community. Thank you.
Thank you, Councilor Coleman. Mr. McManus, did you have your hand up still, Mike? No. Okay, so I mean, I think the expense is reasonable. I think you know, if we can have the gas and electric work with Mr. Moriarty and Mr. Williams to create put lighting so that alleyway where we know we've had both legal problems and health problems and needles and all the other kind of things, if we can start to reduce that, that certainly would improve the quality in that neighborhood. So I'll entertain a motion that the order has been complied with the understanding that gas and electric will work with Mr. Moriarty and Mr. Williams to create a lighting situation all the way through that alley.
I'll second that.
Okay.
So moved.
Okay. Any other comments? All those in favor?
Aye.
I think Mr. Williams had a follow-up.
Oh, I'm sorry,
Chairman
Mr.
Murphy.
Yeah, I just
sorry.
wanted, we have quite a few of the contract lightings already, and maybe we can take some of those lights we have and move them to the back of my lot, I think, some of them. Maybe we could utilize some of those that we already have.
Okay.
Yeah, we can move anything you got, Scott, to do that.
Okay, and I wanted to let you know that the company that I use for the software that I bought, which is under $100 to purchase, is Blue Iris, if for anybody that wants to know about it, what it is. It's called Blue Iris. And I'm using FOSCAM cameras.
Okay, thank you very much.
You guys
And
know it. Just so
hopefully
you-
we're gonna make improvements in that alleyway, so we're doing what we can, Mr. Williams, Mr. Moriarty, so we want to make sure things are going well. So the order has, the motion is that the order's been complied with. The HD&E will work with Mr. Moriarty and Mr. Williams on the installation to kind of create a less enticing area for people to commit crime and other things. So thank you very much. I think that's it for you, Mr. Lavelle. First of all those in favor?
Aye.
Aye.
Opposed? Okay. Thank you, Mr. Lavelle, Mr. Williams, Mr. Moriarty. I appreciate your time.
Mr. Murphy, would you give Mr. Lavelle my cell phone number so that he can call me when he needs to?
Yeah,
So he has that's the best way for him to get a hold of me.
I think I have it, and if not, I'll email you tomorrow to get it. But I think I have it.
Okay. Yep. Okay. Thank you.
I had it from the first time. Whether I still have it, that's another thing.
Okay. Thank you.
You know, I got my flip phone going.
Happy New Year, everybody.
Happy New Year.
Happy New Year.
Yeah. Good night, everyone. Happy New Year. Thank you.
Happy New Year. Thank you.
Entertain a motion to take up item 6.
Take up item 6.
Okay, motion introduced. All in favor?
Aye.
Aye.
Motion order introduced by Councilor Bartley and Councilor Graney. Order that the DPW, Suez, and the city engineer develop a plan to regrade the top of West Glen Street. Due to the current grading, water is not flowing to the catch basins, resulting in dangerous road conditions. Once a plan is developed, please consult with the mayor and city council to implement financing. Departments in this order and the residents of this area, including the south end on Martin Street, are aware of the needs. And this has been referred both to public safety and to finance. Councilor Bartley, I believe, is here. Okay, Councilor
We're
Bartley.
Yeah, I hope everybody's, thank you, Mr. Chairman. I hope everybody's familiar with the area. So I don't think anybody from the neighborhood is, oh, there's Miss McKissick.
And
I see
Dana.
Miss McKissick. Oh, and I see Dana. Look at this.
Yes.
So it's
Carol's here
you
as
know,
well.
they're more in tune with what's happening, and so I would ask the chair to entertain a motion to suspend and allow the public to speak, and maybe just let them perhaps 2 or 3 minute presentation on what they think is the effect.
Make a motion to open it up.
Second.
For speaking.
Second.
All in favor?
Aye.
Aye.
Okay, and I know Dana contacted me today and indicated he was going to be the spokesperson in terms of most of the issues. So Dana, can we turn it over to you?
Absolutely. Thank you, Chairman. I want to thank the committee and Councilman Bartley for taking up this issue. In light of today's events, this feels a little more precious for our democracy, so it's really greatly appreciated. Thank you. So I've lived here for 11 years, and during that time, I've actually watched the road deteriorate. My third year here, Councilman Bartley assisted in getting a curb repurposed up on the hill, and that stopped our basement from flooding every single time it rained. Didn't matter the amount of rain. Even a sprinkle, it would actually flood. And so the issue actually starts at the very top of West Glen. The water from the street above comes unabated directly down. There is no catch basin there. There's no curb there or anything. And currently with the melt that's happening, and this started happening last spring, the water is bubbling up through the pavement, and it's actually now becoming spongy at the very top. So it's literally from the top all the way down. The water runs unabated in such strength it actually has cut a path through the pavement where you can actually see it going right past my driveway on the down as you look downhill on the left-hand side. About halfway down, there is a catch basin that Suez about 7 years ago worked on. And since that time, it has not caught barely any of the water that comes out of the greenway on the right-hand side. It spills right out and over, and it doesn't have enough rock. So every time it just brings mud and sludge and leaves down on top of it. So we're constantly unclogging it. As you travel further down the hill, on the left-hand side is another catch basin. The water from the top that goes past my driveway and the left-hand downhill side completely misses the catch basin. It does not hit the catch basin at all. So the residents, myself and a resident actually on Martin Street, we've taken to putting leaves and sand and sticks, trying to divert the flow of water that at times is almost ankle deep to actually into that catch basin. What that water does is it actually goes around the corner and straight onto West Glen where the hill kind of meets. And that's a very busy intersection between West Glen and Martin Street. And it pools. Additionally, on 82 West Glen Street, there is a driveway, and that water leaves the driveway and pools there because it has nowhere to go. It just kind of sits there. This combined with raised water tables, especially in the winter when it's kind of bubbling from my driveway and further down, creates basically a frozen waterfall. Councilman Bartley has actually knocked on our door and said, please don't leave. It's too dangerous to drive. I've had all three of my vehicles, two of which have all-wheel drive or four-wheel drive, all three have snow tires. I've spun out at one time or another coming up or down the hill. It is exceedingly dangerous, and with the best way I can put it is that there are more prevalent rental properties in our direct neighborhood now. So there's a larger number of cars parking on the street. And it is always a busy cut through for the fire department and other people trying to avoid traffic on rush hour on Route 5. I'm terrified that we're going to have a tragic incident at some point, let alone my inability to sometimes leave my home when I need to. I know that this year especially is exceedingly difficult to find the financial resources for infrastructure, and that is understood. But this would be one of the areas where the city is heading off a tragic incident at the path, so something worse doesn't occur. We as the residents up here, we're constantly always looking out for each other and working on it, and we will work in any way we can with the city and the engineers to really kind of get this done. It would really improve the quality of life for us on a daily basis. We've even seen trash trucks, sanders, and plows being unable to make it up our hill at times because it is so bad. And the DPW does the best that they can. They really have made an effort to step up and come and try to sand as much as possible. So that's really greatly appreciated.
Well, first of all, thank you for taking the time. And I know I tried to get you by 7:30, but I didn't quite get there. So, but we had important issues and you were listening.
Of course.
The issues were there. We did get a report and Councilor Bartley, I think you got that report, right? Okay.
Yes, I have it, Mr. Chairman. I will email it to Dana, and I know he'll forward to the McKizicks and the rest of the crew up there. So, but you got Mr. Parent here, Mr. McManus, yep. So maybe they could speak to it.
I want to thank them for not waiting. I know I tried to do them 7:30, but I appreciate everybody's patience. So, Bob or Mike, would you like to I know you gave a pretty detailed explanation and the cost. If you
Sure.
can go over what it would take and when it could be done. If we had the money, when could it be done?
Well, first, I just want to state that I agree with everything that Mr. Hunt stated in terms of observations. I went out there a couple of weeks ago, right after the snowstorm, and we were in the midst of the warm up and the melt, and the observations he had of the water seeping out of the pavement is true. It comes out of the pavement, then ices right across the street before it even would have a chance to get to the catch basin. So really the solution, unfortunately, is to reconstruct about 150 feet of roadway from the intersection of Martin up the hill, and to then reconstruct the intersection of Martin itself, and put in a couple of additional catch basins, as well as really regrading and crowning the roadway such that you can direct the water into the catch basins. It's at a point right now that, you know, until you can really build the roadway back up with the cross section that it should have, you can't make the water go where it needs to go. Another thing that I'd ultimately recommend doing, because of the issue in the high groundwater table, is what I've had work in a number of places, is you actually put a stone drain underneath the pavement towards the top of the hill that would intercept that water that's currently running underneath the pavement and seeping up through the pavement and carrying that out to the catch basin as well. So not only are you trying to control the water that's on top of the roadway, but also trying to control the water that's underneath the roadway as well, so that doesn't seep out and create problems. Not inexpensive, you know, estimating the cost of that being in the range of $35,000 to $40,000. I did, because I wasn't certain about the status of whether or not the city had taken that section of West Glen or not. The city did. The city took West Glen in two different pieces. The first piece was taken, I believe, in the 1920s up to Martin Street, and then it took 200 plus feet from the center line of Martin Street up the hill in 1952, I believe. So yep. We do own it. We do have the ability to utilize Chapter 90 money or other public funds on any type of improvements that we would make on that roadway. So to your question of timing, obviously we wouldn't be able to do it now. So sources of funding would be either some type of capital appropriation or Chapter 90 funding, which obviously there's lots of competing demands for that, but it's our biggest pool of road reconstruction money. And it's something that we could most likely, and I'll let Mike jump in if you'd like, but, you know, we could focus on and try to nail, you know, summertime such that the problem would be solved before next winter. If the decisions were made to expend Chapter 90 funding, or we received other funding to allow us to move forward with it.
Thank you, Mr. Parent. Mike, would you like to comment on that, or?
Yeah, I mean, I agree with Bob. There's also, since it's a drainage project, we could split it up into drainage on one hand and then road rehabilitation on another. And we can use Suez for the drainage. Part of our contract, we have an allowance of $130,000 every year for sewer and storm drain repairs. If we exceed that allowance, we have to pay the difference on a true up at the end of the year. We've already exceeded that allowance so far this year with some sewer collapses and other, you know, miscellaneous catch basin, manhole cover repairs that have been done. But that is a fund that we could use to do the drainage. Looking at the pavement management plan that we pulled together last year, this section of road is, you know, one of the hill part, at least, is one of the worst rated sections of road in the city. So it does bump up to the top of the list, if you will, for rehabilitation. And as Bob said, Chapter 90 would be a good source for that. You can use Chapter 90 for drainage projects. But we have a couple of funds that we can utilize. And as Bob said, I think this would be a good summertime project. DPW, we're well aware of this. You know, and as Mr. Hunt had said, we do get calls from our trash trucks saying I'm stuck, send a sander, and we mobilize a sander to go out and try to make the road passable as it occurs.
Okay, thank you. Councilor Tallman?
Mr. Chairman?
Yeah, I'll get you in a second, Mr. Gray, Councilor Graney.
Thank you. Yeah, thank you, Mr. Chairman. I'm very familiar with that roadway of a letter carrier for a number of years, and was up on that hill for maybe 8 to 10 times in the past 5 years of my career. And it is a very dangerous area, very tough hill, especially in the wintertime when it ices up. And I do remember that even maybe 5 to 10 years ago, that road starting to break up and crack up, especially during the heavy rain. So any way that the DPW could put this right on the front burner, I think it's imperative that the safety of the residents up there that live on the top of the hill and the ones down on Martin Street get that issue taken care of, because they have to deal with this, you know, not only you know, in the fall with the leaves and the rain, but the wintertime, just basically trying to get out of their driveways. So anything that the DPW and the engineer can do to try to get this done by the summertime, I think, and as DPW director stated, that it's one of the worst hillways in the city, rated one of the worst, that this should really take precedence over other areas of the city right now. So I really believe and back this this motion to try to get the funding for this as soon as possible, and try to get the work done maybe sometime right after the new fiscal year starts. Thank you very much.
Thank you, Councilor Tallman. Councilor Graney, then Councilor Bartley.
Yeah, I just want to add what Councilor Tallman said, that this is a problem that's been festering maybe for 20 years in that present location. I know people that used to live on West Glen Street at the base of the hill, and it goes back a long time. So I think it should be a priority issue for us, for the council, for the city to work as soon as possible to get the funding and get this problem taken care of. Thank you.
Thank you, Councilor Graney. Councilor Bartley?
Yeah, unless the residents want to add some additional thoughts, just in terms of wrapping this up, so, because I know it's been a long meeting already, it's been a long day for all of us. So I just want to make a couple points. One is that I took some notes here about the pavement management plan. So I didn't even realize we had a pavement management plan. And to hear that the top of West Glen is one of the worst rated, I think that bears repeating. I did realize we had road rehab allowance fund with SOAS. I didn't know we were tapped on that, but we usually don't get too many updates about that. So perhaps at some point, Ms. McManus or somebody from the department could maybe just forward a report to the Council of the Communications, so we kind of know what the status is of that. Because third of all, I have to compliment Mike and Bob and everybody from Public Works and all that. Has been up there multiple times, and they've seen it. And so and as well as SUAS, you know, Kevin and Mike Williams have been up there with me on numerous occasions, and they did try to put in a sleeve near 82 Martin, and I think it had some effect, but you know, we knew it was a Band-Aid, and you know, so something's a little more comprehensive thing. Frankly, I thought this was going to be a lot more when I got to the bottom and I saw 40,000 for that. That sounded fairly reasonable, because I remember Councilor McGee, when he was finance chair, this is probably in 2014, we had a drainage issue on Woodland Street, and Councilor McGee was helpful. And that was, Todd, if you remember, that was $30,000. So I don't know if you remember that, but that was, I know you were instrumental in helping move that forward. And then the last point is, Mr. Chairman, besides saying thank you again to you and the committee as well for the meeting, I think as you referenced, I did copy this to finance. It would be my opinion that you could probably say this is complied with here, we're fortunate that we have Councilor McGivern on this committee, who is also the chairman of the finance committee. So at some point, Councilor McGivern, perhaps, if I may, to the chair, to the finance chair, could perhaps when you see fit, but when, March, maybe we could take this up again, Joe, in finance, and maybe have Mike and Bob and maybe Mr. Williams come in, and maybe we could talk about the rehab allowance fund for Suez. Maybe we could talk about, we won't know Chapter 90 funds at that point, but maybe we could talk about, the timing issue, because I mean, this is to me a glimmer of hope, and now that we have a potential of getting it done, we have a financial couple of sources, and we could maybe at a timetable, maybe we could get it done next fiscal year, which would be welcome. So that's it. Thank you.
Thank you, Councilor McGivern.
Thank you, Mr. Chair. And yes, Councilor Bartley, we certainly will be happy to tackle that in a timely fashion and see if we can get on top of it. One question, if I could, through the chair to Mr. Parent. Bob, on the, I get the surface water, and I concur with what everybody's saying here, and I appreciate you and Mike talking about making some efforts on a high priority. But what is the underground water? What's the source?
The hillside. You've got a long hillside. You've got water that runs down the hill that, when water is flowing down a steep slope, it tends to want to break out of that slope. And that's what happens. It wants to come to the surface, and it tries to come to the surface and does now, because of, and probably very tight soils there, I would imagine. And we haven't done any test borings or test pits, but I'd be a little bit concerned that there might be ledge underneath there as well. That would be an issue.
I think we can guarantee you as hookers that there's shale underneath it, and it's a high water table. I don't think you have to do any studies there between Councilor Bartley and myself over on Downing Ave. We can tell you, it's a problem. It's a big problem. But will catch basins solve the underground water problem?
No, it won't, and that's why I mentioned the idea of what I would call a blanket drain. What you'd do is partway up the hillside, you would put in probably 12 inches, 18 inches of crushed stone that would run the width of the roadway, and then you'd put a perforated pipe in the stone, so it would be a blanket that intercepts that water as it's flowing below the roadway, and then through the piping brings it to the same piping that the catch basin is connected with, too, because you're correct, the surface drainage is only part of the problem.
Okay. You are a godsend, and Councilor Bartley and I are going to put you to a lot of work the next couple of years.
Okay.
Wait till you see behind the soldiers' home. Wait till the Commonwealth realizes there's a neighborhood back there.
I hope the Commonwealth is on board with protecting that neighborhood.
If I may, Mr. Chairman, one more comment. I just have to thank Councilor Tallman, because Councilor Tallman has walked those 22 acres with me that is just to the south of, and it's that area, and so that's a very slopey, it's heavily pitched, and you add to that with that water kind of funneling into a dilapidated catch basin, and the water coming from Eastern Promenade and bubbling up now. I didn't realize it bubbled up. So yeah, that is it's like the perfect storm there for groundwater, other than behind Councilor McGivern's house. There's just a lot of there's a lot of issues. So I really appreciate everybody pitching in here and giving some ideas. Thank you.
I'll entertain a motion that this order has been complied with, and that the Public Safety Committee would recommend the City Council encourage the mayor to submit whatever financial needs to get this done at the earliest, with summer being the latest. This has got to get done.
If I can suggest, Mr. Chairman, that the order's been complied with in public safety, but if we now put the original order over to finance.
Yeah, that's what I was going to say.
Okay. Okay. So you want
to make sure we track it and then harass it for the money.
Yeah. Okay.
So I'll second Councilor McGivern's that's complied with, but send it to finance so we can stay on top of it to get it done.
Okay, and Mr. McKissick and Mr. Hunt, are you both okay with what we're talking about?
I really appreciate all the effort. So thank you
Okay.
folks very much. I thank the committee and the DPW and the engineer. Thank you.
And hopefully we can get this resolved. And I will tell you, if we can't do it with Chapter 90 and we can't do it with something else, we need to look at some of the money that we have in the city to do that. You can't keep. It's a quality of life issue for you, just like it's a quality of life issue in terms of crime for the other people. So,
yep,
we'll work to try to get what we can for you. Thank you for your time and your patience, and I appreciate your input.
Thank you, folks. I really appreciate it.
Thank you for being here.
The order's been complied with, and we will refer that to finance. All in favor?
Aye.
Opposed? The ayes have it. Next item, I'll entertain a motion to take item 7.
Item 7 off the table.
Okay, introduced by Council McGee and also now has been amended by Council Graney. Ordered that the DPW give the Public Safety Committee an update on the sidewalk repairs from Northampton Street around the Hampton Knolls Road area. And then we've also added Woods Avenue.
Yeah.
Council McGee, would you like to start?
I know we got reports about budgets or bonds or something being passed, but I guess I need more of a time frame as to what we're looking at. I'm not sure if everyone knows about the areas that I'm talking about, but if you go down Northampton Street, Hampton Knolls down towards Mountain Park, I'll be realistic. There is no sidewalk. There's pieces missing. I'm getting calls and emails saying I'm snow blowing and I'm firing rocks at cars coming down Northampton Street through my snowblower because it's so broken up and it's just in disarray. It's unsafe, whether you're on Hampden Street or you're on Northampton Street. I get it. It's all over the place. And I know working with the former Ward 7 counselor, Gordon Alexander, he had thoughts of, bringing the sidewalks out more to give, green space as well as help deter speeding and everything else. And if you look at the streets now, the way they paved it several years back is they cut down the middle, but not up to the sidewalks and just paved down the middle and took off. So, if you look at what happened from Northampton up to Mount Tom, they redid everything, put in a new bike lane and all that and new sidewalks. Well, from there going down towards, Hampden Street, it's a mess. So we're trying to figure out what way we could do to deal with the unsafe sidewalks, but at the same time, deal with the street that was never really paved correctly many moons ago and causing water erosion and issues. And what can we do? Because it is a hot topic in the area. They really want some type of action on it because it's getting worse by the year.
Okay. And we did get a communication from Bob and Mike that the legislature did include the project, but exactly what that is.
I saw the 5-year and 2.5 million, but I guess in order to go back to people who really are anxious about getting this done, kind of like what we saw in Ward 3, Councilor Bartley's area, where they redid Northampton Street and stuff, and it looks beautiful. What can these residents, time frame wise, what are we expecting? What are we looking at?
Mike or Bob, can you answer that?
Sure. So the project that we submitted to the state, that $2.5 million project, was resurfacing the pavement from Shawmut Street to Mount Tom Access Road, and also the sidewalks along the street. So that project was included in the transportation bond bill, which was approved by the House and Senate last night. It's gone to the governor for his signature. It's a 5-year bond bill, which means now it would be up to the governor to decide which projects are funded each year out of this omnibus transportation bond bill. Holyoke, he could say, yeah, Holyoke's projects are going year 1, or year 5. So as far as a date, we don't know right now when that would be. We were given this opportunity last fall with Rep. Velas. He pulled all of his member communities and said, "Hey, give me your wish list for a road project, a transportation project, and I'll put it in this bond bill, and we'll get some infrastructure improvements done." And this is it's the first one that we thought of, and because of the cost, really that $2.5 million for the road, but also the sidewalks. Sidewalks are very expensive to have done. The Northampton Street project down south, up to Beach Street, we just did the road. We did milling and paving of the roads and striping. We didn't touch the sidewalks at all in that project. And that's kind of what happened with this stretch of Northampton Street years ago. When Bill was here, he envisioned a multi-year project where one year he would do the pavement in the middle, and then a year or two later he would come back and do a sidewalk on one side, a sidewalk on the other side, and the sidewalks never got done because they're so expensive. We try to use funds other than Chapter 90 for sidewalks, like the CDBG, but this area isn't eligible for CDBG. We used Chapter 90 a few years ago for Taylor Street, the dead end section of Taylor Street, for their sidewalk replacements. They had asphalt sidewalks. We put concrete sidewalks in, and that was it was around $150,000 for that section of Taylor Street. So I mean, that's the answer for kind of where we are with this section of Northampton Street. It's been approved. We could get it funded. I don't know who or how we can put pressure on the governor's office to release funding for this project. But other than Chapter 90 or local funds, I don't know of any other funding source for these improvements.
In the magnitude of the project, it would take 2 years of more than 2 years of Chapter 90 funding to pay for the project, which would mean
our allotment every year is $1,050,000, give or take.
So it is our best opportunity. Hopefully the governor signs and I believe he's been talking about the transportation bond bill for a long time. So I would expect he'd sign it, and then it's a question of lobbying the governor. And I believe it's the Department of Administration and Finance that has to match bond costs with revenue to try to figure out what gets done on an annual basis so that they can actually pay for the bonding improvements that the legislature approves. So it would be lobbying through the state legislature to make this a priority. If we did get the funding, it would be the best possible deal because it would all be state funding. We wouldn't have to dip into our Chapter 90, or we wouldn't have to go to the City Council and Finance Committee looking for a capital appropriation that the residents would have to fund.
And we were going to split up the road portion, road rehabilitation, over 2 years of Chapter 90. We were going to do from, I think from Bemis to Hamden, and then the next year from Bemis to Mount Tom Access Road. But this is just it's an opportunity to save that money to use elsewhere in the city. And the section from Mount Tom Access Road to Northampton, that's all state controlled. So the state paid for the resurfacing and the bike lanes when they did that a couple years ago. And we would pick up those bike lanes and carry them through the corridor with this project.
And we had similar thoughts of narrowing the roadway down to help slow down speed, increase the width of the green belt, expand the sidewalks, do other things that help to calm the traffic in that corridor. And that would be the time to do it as part of a large project like that.
So that would be included in, so if the governor signs it, and we can help push it within the, hopefully with faster than 5 years, that would be within the scope of the project to widen the sidewalks or green space you're looking to do that.
Yes, it's actually cheaper to put in green space than pavement or concrete. So we wouldn't have any problem funding less of either one of those.
Okay. No, it's good to know, because that was one of the requests by constituents on that strip.
We would have to look at utilities though before we widen the sidewalk everywhere. I know Gas and Electric did a project a couple years ago where they put in a gas line, and we wouldn't want to relocate the curb right on top of their gas line.
What about the utility poles? If you're going down, some utility poles are kind of like almost in the middle of the sidewalk, and kind of would that be addressed in this as well, like moving them, pushing them out in, whatever? That's
So
always been a question.
Yeah, when you start to add utility work, that adds to the cost. The number that we came up with, I'm pretty sure it was just for asphalt and sidewalks.
Okay.
Although it may look a little strange, ADA requirements actually allow you to, the minimum sidewalk width is 4 feet to meet ADA requirements. Mass DOT is now standardized on 5 feet. You can comply with ADA at locations such as pole locations if you narrow down to 3 feet right at the pole location. So it isn't a problem necessarily to have poles that are partially within the sidewalk. You just can't have the entire sidewalk 3 feet wide. You then have to open it back up to 4 feet or 5 feet as Mass DOT standard.
Okay.
We'd have to look at it and try to meet those requirements, because anytime, particularly if we're using state money of any type, we have to meet all the ADA requirements for anything new that we do.
That includes Chapter 90 work. When we do repaving, if we repave up against a curb ramp, a handicap access ramp, if it's not in compliance, we have to make it in compliance. So that's one of the things that we have to consider when we do road projects.
All right, no, this was perfect. It's the stuff I needed that I wasn't, people are asking these questions and want, kind of a clear update, not just, I'll get back to you with when something's signed. So this is kind of what I needed, and I appreciate it.
You could tell your constituents to harass the governor.
Oh, I did that once about the treasurer. That got me in trouble too.
I remember that. Councilman McGivern?
We do have a state rep and a state senator, I'm sure, would love to help out with the governor. It's Route 5, gentlemen, and I know Route 5 is a major route in terms of the state, was a more major route before I-91 was put in, but it's still well used by people, coming through Hoyoke, north and south. Back in the 80s, I think it was early 90s, the state completely redid Beach Street. And a lot of the issues you just brought up in terms of traffic mitigation, calming down speed. One of the things they found was, and Beach Street was older, Route 202, obviously, that each block had a different width to it. And that was a problem with accidents in the middle of the block, a problem with traffic coming through. And they calmed down the traffic, by synchronizing the lights and making sure people got through, which I think to this day is held true. But when they redid the street, they were able to, be consistent with the width, block to block, and it made a major difference. Not 100%, but certainly made a major difference in calming down traffic. So I just wanted you to take that into consideration when the plans are being finalized. And I hope, all the property owners, Mr. President, are in favor of bigger tree belts, because that's a lot more lawn mowing. But if it works, I guess it's okay.
Also, Tallman?
Yeah, thank you, Mr. Chairman. I believe this is long overdue, and I'm glad that we got a little bit of update. I'm very familiar with that street. I probably travel it 2 or 3 times a day, Route 5, and having have a couple relatives that actually walk the sidewalk from Hamden all the way out towards Mountain Park Access Road that they constantly talk to me about the issues of the sidewalks, and it's really important to get to the governor to get to sign that bill, and I'd be happy to contact one of my fellow veterans, Mr. Bellis, to try to get to the governor and move this along, and any of our colleagues on the council to talk to our state senator and reps to get moving. I think the sooner the better to get this area, this neighborhood, this really vital part of our city taken care of. So thank you, Mr. Chairman.
Okay, thank you. Councilor Graney, you also wanted to discuss Woods Avenue, and we.
Yes, I piggybacked on Councilor McGee's proposal. I talked to Mike McManus about this before. Woods Avenue, between Hillside and Francis Avenue, has a asphalt sidewalk that's a skinny asphalt sidewalk that goes up that hill. There are new concrete sidewalks on Hillside and up on Francis that are meeting that particular asphalt sidewalk, which is in disrepair. And across the street, there is no sidewalk on the other side of Woods Avenue. So that's the only sidewalk that goes up the street. And I've seen people walking baby carriages down that street, down the road, rather than on the sidewalk. And the constituents in that area would very much appreciate if that issue could be addressed and we could get a concrete sidewalk, which is about 40 yards from Hillside Avenue up to Francis Avenue to meet the other two new concrete sidewalks. Thank you.
Could I just ask if Bob and Mike, if you could take a look at that? That we know what we got coming up on Northampton Street, but we don't know if the governor's going to put it on the first year or the second year or whatever. But if we can also look at that. One other question, if I can ask, let's say we know we're going to be part of the project, but it's the third year of the project. Is there any way that, well, let me ask, if we were to do with city money, the sidewalks, sidewalk part of the project, would we still be eligible for the full reimbursement?
It's hard to say. Earmark money like this, and it literally is, what, 6 words in the bond bill or something like that.
Yeah.
It references Northampton Street, $2.5 million, and not much more than that. So there's not a lot of, it's not a typical Mass DOT project where you have a fairly rigorous procedure you need to follow. It's hard to say. I think that would be a conversation we'd have to have with administration and finance, who is the department that ultimately controls the release of the money. Would they just cut the city a check in advance after the fact, and how we could make that work? But I think there is more flexibility because it is included as an earmark in the bond bill than there might be in some other funding programs.
Okay, yeah, I'm just thinking that maybe we can do some of the sidewalk improvements that Councilor McGee is looking for, knowing they're going to get done whenever we finally get the year that we can do it. Or I think you said it's a 2-year project, right?
No,
It costs 2 years to see Chapter 90 funds
okay,
to cover that.
Okay. But I'm just looking if we can get some of the sidewalks done, knowing that we're going to get the money and knowing we're going to get reimbursed.
Right. So hypothetically, if we were able to get reimbursed, what funding source would we use to do the sidewalks? Because it's not like we could use Chapter 90 money today and pay that back with this tomorrow.
No, I realize that. But I mean, again, if we got sidewalks that are, and from what I'm hearing from Councilor McGee, sidewalks that are certainly in disrepair, if not dangerous, then if we can do something, and then obviously the city's got to, that we would have to get you money, Mike. We won't take it out of your standard budget. But I mean, again, we got issues that we need to deal with, and if we can do that and know we're going to get reimbursed, then we need to come up with some kind of financing to do that.
Could be some type of interim loan or something like that that could be worked out that would get repaid through the grant.
Yeah.
Yeah.
So, so if we can, and Councilor McGee, it's primarily your order, if we could table this and maybe get another update, and once we know what the, if it's going to be, are we first year of the project or the fifth year of the project, we probably will know that probably within the next 45, 60 days. And also,
I think it's complied with. I think I just need Mike or Bob to, email once they get the heads up as to, once they know. So if the governor signs it, but they're told not till year 2, 3, or 4, at least we
can
alert people to that. But I mean, they don't have to come back in. If I can just get an update whenever they get that notice, it would be appreciated.
Yeah, we'll research to see if we can use today's dollars to do sidewalks, as long as we would get paid back in a future year. And we'll let you know what they say about that. And also, as soon as we hear anything, this is one of those projects where there'll be a press release about the scope and schedule.
Okay, thank you.
And I would encourage anyone that has
Councilor
relationships. Sorry.
Councilor Graney?
Yeah, could I have Bob or Mike comment on the Woods Avenue problem?
Yeah.
So Woods Avenue, I'm looking at it through Google Maps. It is asphalt sidewalks. There's even a section on the southern end of Woods where it's gravel when it goes from one driveway to the next. This is remote to our project on Northampton Street, so I don't think we would be able to use that money from the state for this project. I don't believe it would be eligible for CDBG just based on the location in the city, but we could always ask. Asphalt sidewalks are cheaper than concrete sidewalks. It is a relatively short section, from intersection to intersection. So we could do an estimate, a cost estimate, and see how much would it be to put concrete sidewalks in, and try to budget and schedule for the installation.
I'd appreciate that, Mike. I'd appreciate that, and the residents would also.
Thank you, Mike. If you can do that and just let Councilor Grandy know, and then we can follow up if we need to do anything else.
Okay.
That'd be all right, everybody? Okay, so the order, the motion is that the order has been complied with. Is there a second?
I'll second that, Mr. Chairman. We lost our president. He got bounced out. He's trying to get back in.
Okay, well, I'll second your second.
Move it to the highest, all in.
All those in favor? Aye.
Aye.
Opposed? So I already wrote down 3-0. So now do I have to make it 2-0 because officially he wasn't here?
Wait a minute, I'll text him.
Okay. I'll say it's 3-0.
3-0.
Don't get me in trouble. All right, the last one is from Councilor Anderson Burgos, who's had a long day. Congratulations. I know you were getting, don't be sleeping. You're a young guy. But he had a good day out in Boston getting oriented from what I understand. And so the last one is by him, ordered that the manhole cover over the sewer drain in front of 203 West Franklin Street be replaced. The resident of this location, as well as others in the area, have reported that it appears to be damaged and degrading. They have also reported that the damage has caused drainage issues, resulting in excess water on the sidewalk and onto the property during heavy rain. And I think you're going to be pleased with the response. And I don't know if did you get a chance to get the response?
Yes.
Okay. So, answer.
Yeah, I mean, yeah. So I'm pretty sure, Mike, you've been there already, and Bob, you've been there too, right? You've already, I walk way around that section. It's like very, very bad. As a matter of fact, I don't think I recall ever seeing a manhole that old. Like that's like way old, like antique-ish, But yeah, it's very, very dangerous, and it is causing flooding in that area. And it's something that I'm looking forward for us to get to work on as soon as possible.
Right, we did indicate that it would be a springtime task. It's likely the concrete slab, as you know better than I, it's actually the concrete and the reinforcing steel that's sticking out of the concrete on the edge of the slab. That's going to have to be taken out, replaced.
Yeah.
The metal portion of the structure might be able to be reinstalled, or likely will be installed with a new version of what's there.
Okay, that's great. Happy
With
to
that,
hear.
you're good with that one?
Yeah, of course, yes. I'm
So-
sure the residents in that area would be very happy.
Okay. Bob, Mike, thank you very much. I appreciate your patience. I tried to give you an idea with 7:30, but obviously you never know.
Understood.
But I do appreciate you coming on, and I appreciate the input that you've given us. And we've got some issues that we're resolving, and hopefully we're going to continue to resolve more. So I'll entertain a motion that this.
Make a motion the order is complied with.
Okay. Did Todd come back on yet?
I don't, unless he's
I think
trying by
that's-
telephone.
Todd, is that you by phone? Nope. Okay, I'll second the motion. All in favor?
I'll vote twice for Todd.
Oh, no, we're not letting that happen.
No?
Okay. You're trying to
I'll
break
vote
my-
for Todd.
Okay, so that motion has been complied with.
Can you
All
hear
in
me
favor?
now?
Aye.
There's Todd. Hi, Todd.
Aye.
Okay,
Aye.
now it's 3-0. Thank you, Todd, for not causing, and we included you in the last vote too. All right, and also,
Sorry, it just died. I got
I
booted.
thank you, everybody, for your patience. We had, I think, a pretty constructive meeting, and I appreciate your time. And I'll entertain a motion to adjourn.
Motion to adjourn.
Good night, everyone.
Second. All in favor?
Good night.
Night. Thank you.
Good
very
night,
much.
folks.
Good night, everybody. Thank you.
Stay well.
Good night.
Good night.